We seek the truth.
Would you be handing your resignation to the Minister of Culture tomorrow, sir?
No, I will not.
Leader of the opposition, you have accused your government, sir, of using the Grenada Development Bank to facilitate the financing of personal loans for certain government ministers.
The other side is in no position to talk about those issues, and I will leave it there.
We discover new perspectives.
You know his leadership style, and so many are saying, why are you coming now to talk about those issues?
Now is the time to speak. You have the right to decide who will take over.
And you met with Dr. Mitchell, and perhaps you might want to confirm what that meeting was about in your response. But
Dr. Mitchell, like myself, are Grenadians.
We ask the right questions.
Why was there no report on the work done of the commission? And how is this new committee different from the commission that was initially established back in 2022? So who are these elements that are using you?
I'm disappointed in my political leader.
And why is that animating those political conversations now?
This is a very interesting question.
The Bubb Reports with Dr. Kellan Bubb. Thought-provoking, truthful, unbiased, and truly original reporting.
Tell us, a commissioner of police, tell a politician, back off. You have no knowledge of the law. You have no knowledge of law enforcement. You cannot force my officers to do the wrong thing.
But that is somebody's son. That is somebody's child. That is part of a family. And I think that is the part that they are missing out.
Because E and F are apt to be used oppressively.
It's like because we don't see disabled people as sexual beings, which is ridiculous.
You mean they don't want to listen to your version of science? They have
their
own science. You have your science.
What we need to do is teach people to think and not what to think.
Today, it's too bad that everybody do what they want.
If I could forgive Bernard Ford, then I could forgive Bob Morris too. And today, on this day, I no more have anything in my heart for what he did.
The education system has to be very fluid and dynamic because we're living in very different and changing times.
Treating all your citizens equally, all your citizens fairly, recognizing each group, not discriminating against one or the other.
A pleasant good morning to our viewers and listeners, and we welcome you to yet another edition of the Bubb Report. I'm your humble host, Dr. Kellan Bubb. And for those of you who are joining us, you know the drill. You know the drill. It's time to like and share this week's live stream before we get into the editorial. And of course, for our viewers and listeners here in the DMV area, there is the Caribbean Wine and Music Festival that's happening out there in Mount Airy, Maryland. I will be in attendance, and I do hope to see many of you there. That's happening today from 10 a.m. to 6 p.m. In previous years, they have had several acts, including Kes, Patrice Roberts, and other mostly Trinidadian artists who show up to that festival. So it will be a good time to experience some wine and music and to have great fellowship with the West Indian community, with the Grenadian community here in the DMV area. Now let's get straight into the editorial. Now, in the wake of the current White House's election last year, many in the Caribbean cheered because many West Indians and Grenadians aligned with some of the authoritarian values, which goes after people that you collectively dislike. Now, earlier this year on the Bubb Report, I referenced the Lutheran poem, First They Came, made famous during Hitler's reign of fascist terror in Germany, when a Lutheran pastor articulated how Hitler was going after his opponents before eventually going after him. Now, in this current zeitgeist, the regime in Washington is going after everyone, including Grenadian and Caribbean expats, who send regular remittances to their families back home. Now, last week, the Republican regime in Washington passed a tax cut bill to transfer wealth to an already thriving and successful 1%, at the expense of hundreds of millions of working people earning less than $1 million annually, who will be imposing now a remittance tax as part of this package. Now, this bill proposes to impose a 3.5% excise tax, reduced from the initial proposal of 5% on remittances from the United States, that will specifically impact anyone who is not a citizen, including green card holders, H-1B holders, L-1 holders, as well as F-1 visa holders, respectively. So, for example, if you're transferring $1,000 via MoneyGram or Western Union to Grenada, $35 will be deducted as a tax from that. Now, your recipient will receive $965. For Grenadian visa and green card holders in the US, especially those supporting dependents or planning a future back in their homeland, this tax will introduce a new layer of complexity. One, there will be no tax credit. You won't be able to offset this 3.5% amount against federal or state taxes in the United States. Two, reduced receipts. Your family or financial recipients in Grenada will receive less money through remittances by way of Western Union or MoneyGram or other services. Inflated goal costs. 4, planning for large financial goals like buying property in Grenada will now effectively cost 3.5% more than it usually does. And finally, 5, tax stacking. This 3.5% in addition to any US taxes already paid, it's not a substitute. Of course, folks, we're going to be watching this space to see how our remittances will be impacted by this new, what the regime is calling a beautiful bill. Folks, this is the Bubb Report. We'll be right back for the first segment of the program. Please stand by as we go to break.
Don't go there.
You are a technocrat. I mean, you can speak to whether or not it was appropriate or inappropriate for that to occur. Would you have done that as a permanent secretary?
Politicians get the information from wherever source that they can.
That's going to be the extent of your answer.
Yeah.
Don't go there.
There's a lot of noise around the data protection bill that, in my respectful view, is not warranted.
I was one of those making noise, and it's simply because I was concerned about that specific section 33.
Don't go there.
Are you going to be offering yourself up as political leader of the party?
I see you've called me here for much more than diplomatic passports. I don't mind that.
Don't go there.
What is the relationship like between you and your leader, Dr. Mitchell, your boss, Dr. Mitchell?
I'm not sure how to explain how to answer this question at this time. I prefer not to answer.
Don't go there.
They said that you approached the bank for the loan before the election and that it only materialized after the election. There are also conflicting reports around the quantity of monies that were received. What is the reality here?
People try to extort the truth and to make all kinds of things about it. I just stay quiet. So if you notice, I was really and truly quiet about the whole matter.
Well, except with not with the New Today newspaper. The New Today newspaper reported on this, so I'm not sure you were quiet on this. Go ahead, Honorable. Go ahead.
Well, I'm just trying to answer your question, right?
Don't go there.
I think we just spoke at length about the regularization framework. So
yes, we did. But let us talk, Prime Minister. Let us talk about the workers who are dismissed.
The Bubb Report. We go there.
And folks, welcome back to this week's edition of the Bubb Report. Now, the year was 1995, and the then Sir Nicholas Brathwaite, the late Sir Nicholas Brathwaite, and George Bizan-led NDC administration was heading into an election year with the promise of constructing a new state-of-the-art hospital in Mount Gay, the site which currently hosts the Grenada's lone mental health care facility. Now, fast forward to 2002. The previous Dr. Keith Mitchell-led NNP opened a new state-of-the-art hospital in St. George. Now, late Cuban President Fidel Castro had personally promised to aid Grenada with the new state-of-the-art hospital during a visit to Grenada in 1997. Of course, former Health Minister Dr. Clarence Modeste Kerwin said the new hospital was part of a comprehensive plan to overhaul the country's health services sector. Now, it was also in 2003 that the origins of what is now called Project Polaris enters the zeitgeist. The NDC-led Tillman Thomas administration proposed the construction of a new teaching hospital at the site that is currently being proposed under Project Polaris. Of course, the Tillman Thomas NDC lost the 2013 election and was relegated into the political wilderness until 2002 under a new leader, the Honorable Deacon Mitchell. Now, of course, the underlying theme here is a policy-level desire for improved healthcare services across multiple administrations. The grim reality of healthcare in Grenada is that despite an effective decentralized primary healthcare infrastructure, secondary care remains a challenge. Additionally, chronic and non-communicable diseases, including diabetes, cancer, cardiovascular, and respiratory illnesses, have emerged as the main cause of premature death in the country. Now, risk factors for these diseases include overconsumption of alcohol, poor nutrition, obesity, lack of physical activity, and hypertension. Now, the average working class Grenadian also cannot afford efficient and consistent medical treatment and consequently have worse healthcare outcomes as a result. Now, today on our program, we will continue our deep dive into Project Polaris, a long-held vision of previous and current NDC governments to tackle the perennial challenges of healthcare in Grenada. And here to make sense of this issue is, of course, Ms. Andrea St. Bernard, who is appearing on the Bubb Report for the first time. We've had background conversations of you coming on the program, so I'm happy that you've made the time for us this week, madam, as well as Mr. Damian Dolland. Of course, Ms. St. Bernard is a project sponsor of Project Polaris, and Mr. Dolland is the lead consultant who I've also had conversations with on the issue of coming on the Bubb Report. So, ladies and gentlemen, welcome to the program this week.
Thank you.
Thank you, Dr. Bubb. It's a pleasure to be with you.
Absolutely. Of course, Project Polaris, it's all in the news now. And let us first, I want to begin with you, Ms. St. Bernard. Of course, we know that Mount Sinai, they were in Grenada doing that initial round of consultation, and perhaps Mr. Dolland can jump in here on that as well. Can we talk about the specific outcomes of the initial consultation that Mount Sinai embarked upon? What were some of the outcomes, the specific deliverables that they have expected, that they expect the ministry to be implementing in advance of the construction of this new facility?
Well, thank you for the question, Dr. Bubb. And I think I want to also thank you for the introduction that you provided, which really gave a very good context for where we are in our desire to improve healthcare overall in Grenada, and in fact, where we are in our efforts to do so. And so the reality is we have a tall task ahead of us and a significant challenge, but the need, the desire, I think across, as you said, across party lines and amongst all Grenadians to achieve improved healthcare is consistent. And so we have had to look at what will be our approach to ensure that in this instance, we will be successful in creating a new state-of-the-art hospital, which will then lay the basis and be the cornerstone for improved healthcare throughout the Grenada system. So Mount Sinai is one very important critical partner in that journey towards excellent healthcare. And it's important to understand what is it that Mount Sinai is here to do and to offer us. And really, the relationship with Mount Sinai is very much focused on improving standards of health service delivery, quality, and safety. Because we know where we are and we know where we want to be, we have to have a plan to determine how do we get there. We have to start with understanding what is our current status, where are our current deficiencies, and then working really with the best in the world to give us the guidance that we need to get where we're going. And this is really the partnership collaboration that we've embarked on with Mount Sinai. So even as we have begun to make plans both for the design, development, and operation of the new hospital, Mount Sinai has already engaged with our current hospital to do an assessment, as you indicated, and to work very closely with the Ministry of Health and the hospital management team to prepare a plan to address the necessary improvements in standards, policies, and governance that will lead to the necessary incremental improvements and ultimately allow us to offer world-class healthcare. So that just, I think, lays a little bit of the backdrop of absolutely what we have embarked on. The other point I want to just mention to lay the context is ultimately the goal is that we will have world-class healthcare service. And what does that mean? Well, I think it's worth putting out the concept and sensitizing or letting everyone understand what is world-class international standard of healthcare. And our goal really is to achieve JCI accreditation at this new hospital. So Joint Commission International is the global gold standard for health care, quality, and safety service. Achieving JCI accreditation gives us that certification. So again, this is just to set the stage for what are we trying to achieve. And then I will go back now to your specific question.
The specific question, and we will get back to the question of certification, because that was actually something I intend to raise following a previous conversation that we had with a health consultant last week. But let's talk about those deliverables, because currently, the hospital may take a couple of years to construct. As it stands now, there are specific deficiencies at our current hospital facility that needs to be addressed in respect of service, in respect of medication, in respect of the culture of care, really. So what specific recommendations did Mount Sinai make to get us to a place where we at least can have better care going into a new facility? Because you can go into a new facility and these systemic challenges may still remain. So let's, Mr. Dolan, perhaps you might want to articulate what those recommendations were.
No, thank you, Dr. Bubb. I think it was important to set the context as Ms. St. Bernard has provided. But going into the specifics, as you've indicated or that you've requested, after the 3-month consultation, this involved over 24 Mount Sinai specialists visiting Grenada. This involved the entire hospital staff at the General Hospital, as well as the leadership in the Ministry of Health. And ultimately, it came out at the end of that process, there were 11 key work streams that were identified by Mount Sinai and agreed with the General Hospital leadership that we needed to focus on immediately, not for the new hospital, but to get the current level of care at the General Hospital to the level that we need and that we require as Grenadians. And so in terms of those 11 specific work streams, they range from quality and safety to nursing, OBGYN, IT and IT infrastructure, infection prevention, governance, organizational culture. I think you indicated that earlier on the call, labs, facilities, pharmacy, and operations generally, which will include medical records, inventory management, etc. Within those 11 work streams, there are over 36 sub-work streams that were identified, again, jointly between Mount Sinai and the Grenada General Hospital Management Team. And what they've developed is a 15-month initial work plan where there's specific teams that have been staffed by the government, by the General Hospital leadership, in conjunction with Mount Sinai, to be able to deliver on concrete, measurable activities and goals over the next 15 months as a first step.
Mm-hmm. So let us talk about how that's going to be implemented. Is that going to be implemented in tandem with staff at Mount Sinai, or is that going to be implemented independent of Mount Sinai for this specific issue, for these specific deliverables?
For this specific issue, and it goes back to a broader point which we'll probably discuss a little bit later on the call, about how the hospital and the relationship between Mount Sinai and the General Hospital, the nature of it. But this is, again, Grenada first, Grenada-driven initiatives. And we have partnered with Mount Sinai to be able to give us that international expertise, but we need to deliver it for ourselves. So what it is joint teams led in Grenada, but being guided by Mount Sinai professionals in each of the core disciplines, and the Mount Sinai staff will come down on a periodic basis. So each month, various Mount Sinai teams come down and engage with our local teams. In addition to that, on a weekly and a bi-weekly basis, they have virtual meetings to make sure that whatever the deliverables are, that we are kept on track as the government of Grenada and the General Hospital management team to be able to implement. Because again, we have a large staff component locally that we need to upskill, we need to train. And so this is about knowledge transfer, this is about skills uplifting, and putting in place processes that not only do we need for the current hospital, but that can be replicated throughout all our other hospitals in Grenada and throughout the primary healthcare system.
There is a dearth of specialists in Grenada in many areas. Is that something that Mount Sinai identified, and what will be, because to get specialist care, whether it's in urology, oncology, sometimes you have to go out of the public healthcare system to do that. So is that something that Mount Sinai identified? And in the context of this, the implementation of these recommendations, how are we going to treat with that lack of specialist care that exists currently? And is that something that Ms. Senbernat, perhaps you can articulate how that's going to happen?
Sure. So, I mean, it's no secret that we have some deficiencies with regards to specialist healthcare professionals in general. And we absolutely, as a government, are working on a comprehensive plan to address that. Mount Sinai, again, is a key partner in formulating that plan, but it really does go beyond just Project Polaris and certainly beyond just Mount Sinai. So the government of Grenada is working on a comprehensive plan, which includes training, upskilling, recruiting, attracting new talent, but it's a multifaceted plan that will have to be put in place. It will include the Ministry of Health, the Ministry of Education, various private partnerships, including, for example, SGU and Mount Sinai, working together to really come up with that plan. And keeping in mind, this is not a problem that's unique to Grenada. And so we have to work diligently to find a solution that works for Grenada. And I think the government is certainly committed and working on that. And so more to come in that space.
Now, big picture here, and of course, perhaps this is a policy question that general policy question that you may not be able to respond to. That might be a question for the Minister of Health and the Prime Minister, but I would ask it anyway. Funding quality healthcare comes at a significant cost. Yes, in the United States, you don't get quality healthcare without paying top dollar. Mr. Dolan knows this. Ms. Senbernat, I understand you lived in Canada, so it might be a bit different. But if you need like cosmetic surgery and things like that, your insurance wouldn't cover that. The point is, quality healthcare does come at a significant cost. Now, did Mount Sinai make any recommendations for having a health insurance program to fund patient care in Grenada's healthcare system? Did that come up at all in any of the recommendations or in any of the conversations that you had with Mount Sinai?
So again, I would say that really there's a lot at play in the health space right now. Our relationship with Mount Sinai is very much focused on improving quality of care and service. Okay. And that's their expertise and the experience that they have and they offer. For Project Polaris and for the transformation that we need to see in the health sector, we need to find the best partners with the best subject matter expertise in each of the areas that we need to see change. So Mount Sinai isn't an insurance provider. That wouldn't have been the area that we are depending upon them for advice and consultation, but rather, again, the focus with Mount Sinai is really improving quality, safety, and patient care.
But Mr. Dolan, big picture here on the question of health insurance, and the reason why I'm bringing this up is because, of course, Grenada had a contract with the GPA network, and their goal was to develop a sustainable national health insurance plan. Of course, that was canceled by this current administration. So in big picture, if we're thinking about the quality of care that we're expected to have, if we're thinking about Grenada becoming the tourism capital, the health tourism capital, it probably already is the tourism capital of the OECS. but the context of the health tourism here. How are we going to be funding all of this? Is that something that you have given thought to? This is a general question for both of you, Mr. Dolan.
No, yeah, definitely. We have given a lot of thought to it. And as you've indicated, and as we've discussed with both the Ministry of Finance, the Ministry of Health, and Office of the Prime Minister, national health insurance is critical for the sustainability of really a high level of care in Grenada and throughout any developing country and economy. And so that is critical. But as go back to Mrs. St. Bernard's point, that is not necessarily the remit of Project Polaris. We are working in conjunction with the government on these other matters. But again, that is just one component. In addition to national health insurance, we are working with other institutions, both private sector and on a G2G basis, to be able to get funding, to be able to make sure that this is a reality and that we are able to deliver this hospital and the medical city in the time frame that the government has committed to.
And let us talk about, of course, the management structure here of the current hospital. Of course, the government proposed, I would say implementing what is currently legislation and law, and that is a statutorization structure for the hospital. We heard two competing announcements from the Minister of Health and then from the Prime Minister in respect of timeline for implementation of statutorization at the current hospital. Now, would Mount Sinai be having any management role in this new arrangement with Project Polaris? And if they are intending on having a management role, what would be the terms and conditions of that management role? Because if we're thinking about statutorization, of course, there is a board of directors, you have a CEO, you have a hospital administrator. There is a very clear management structure there. And where would Mount Sinai fit, if at all, would they be fitting in that administrative structure? Ms. St. Bernard?
Yeah, so I'll start by saying that the relationship or the arrangement that we have with Mount Sinai is unique. It's not a typical public-private partnership, so that it's not profit-driven. The management structure is similar to the engagement that we have even at the existing hospital, except more additional engagement. The hospital remains a private or a public hospital. It remains the remit and the responsibility of the government of Grenada. The government then works closely with the Mount Sinai team to set the necessary standards and procedures and governance structures. So Mount Sinai is working in collaboration with the government of Grenada to ensure that the quality and standards at the hospital meet the necessary international standards. But again, it's the government of Grenada's hospital. The statutization is something that the government, again, is committed to as a means of providing an institution with the right structure and accountability to achieve the standards and to achieve a governance structure that permits for really the policies and standards to be set at the head of the hospital and then to be implemented throughout. So Damien, you can expand a little bit on the actual structure. So
Mr. Dolan, yes, let's talk about that structure. What would that look like?
Yeah, so I think just to take a step back, when we look at these various arrangements, they really fall into about three buckets. There's an infrastructure model, there is a discrete model, as well as there's the more integrated model, for example, the Turks and Caicos model, and where management is given to a third party. As indicated by Ms. St. Bernard, the government will continue to own the hospital. It will continue to be responsible for this hospital. And this is a decision, a policy decision taken by the Ministry of Health and the Office of the Prime Minister based on consultation that we've had and viewing various precedents and including engagements with the likes of PAHO to see what has worked around the world. And when it came to looking at how to provide equitable healthcare and healthcare that's accessible to all, there needed to be government driven. So again, high level, under the Statutorization Act, it calls for the government or the Ministry of Health to own all the hospitals. The new hospital will be one hospital under that, and it will have its own structures as well, governance structures that will be substructures to the broader GHA. In addition, we have, as part of that component, we've agreed with Mount Sinai to have Mount Sinai really be our partner in the oversight of quality and safety. These are the things that drive the efficiencies. These are the things that ensure appropriate health outcomes for our citizens, as well as with getting the quality and safety components correct. We know that we'll be able to drive additional traffic throughout the OECS to make sure that Grenada is the medical capital of the region. And so from that perspective, we've specifically agreed with Mount Sinai to have a joint operating committee. And that committee will have equal representation from both parties that will serve as an oversight body for our quality and safety matters. So anything related to quality, quality outcomes, etc., will be under the oversight of that JOC.
Stick a pin there, because last week, Mr. Terran Gilchrist, of course, who was tasked with leading the previous NDC administration's charge in constructing a new hospital, as was indicated in the intro, he articulated, or he was questioning why, for example, the Pan American Health Organization or the World Health Organization will not be involved in that sort of quality control, as you referenced here, and having them sort of as check consultants. The word he used was, of course, having a check consultant. So could you articulate why WHO and PAHO will not be part of this, or will there be any partnership with them as well as part of that process?
Great question. And the reality is, if you look at it, there's two components. PAHO providing insights and guidance as we develop the system, develop the hospital, develop our implementation plan, and develop our governance and other policies. And the reality is PAHO is part of this. We've presented to PAHO. We continue to consult with PAHO throughout the entire journey, right? Where we are now, we are in this phase of working, for example, on the clinical program plan, the human resource plan, and those will be shared with PAHO for PAHO's input. And they're just one of the many parties and stakeholders that we will engage with. But then in terms of the running of the hospital, I think we should make the distinction between the development of the hospital and the operation of the hospital. In terms of the operation of the hospital, even today, PAHO does not operate hospitals. PAHO comes in and they provide oversight. They do review functions of the hospitals. They provide guidance. And those things are going to continue with all the hospitals in Grenada and throughout the health system in Grenada. So in summary, PAHO is a critical party that we will work with and we continue to work with in developing of our medical city and in particular the new hospital. And they'll continue to be a partner in the operational side, but in terms of where they fit in, which is more providing guidance and also providing oversights and helping us access best practice.
Ms. Saint-Bernard, is there anything else you wish to add on that question?
I think that's a good comprehensive overview. I'm comfortable.
Yeah. Okay. Now, and this will delve into a bit of geopolitics here, but of course, the Mount Sinai is an American-based medical service provider, and in Grenada we also have Cuban medical professionals. Now, I do know that there are clear rules of engagement for American companies as it relates to any kind of engagement with Cuba, really, with the United States, because, of course, Cuba is illegally sanctioned by the United States, in my view. Is that something that perhaps Mount Sinai raised, that the government of Grenada is concerned about, to at least protect not only Grenada, but to protect an American company, so that perhaps Mount Sinai would also not be inadvertently sanctioned for perhaps working along with the Cuban medical professionals that we have in our system? I'm not sure if that's something that you thought about.
It certainly is something that we've thought about. All parties are aware of the dynamics. And as I said, we continue to work on our comprehensive plan, understanding all of the factors for the overall HR plan going forward. But certainly these are components that we're aware of, all parties are aware of, and would be factors in the ongoing planning for the comprehensive HR rollout.
Okay, very well. And SGU, of course, SGU does have an articulation agreement with the government of Grenada. What role would SGU be having? Continued role, that is not a new role. I suspect it would be a continued role. But what conversations have you been having with SGU in respect of Project Polaris and the role that they will be playing, given that an additional service provider is coming in from the US as well to work alongside not only the government, but with SGU as another external partner?
So the discussions with SGU have been very exciting. I think everyone recognizes the opportunity that a new state-of-the-art hospital offers to Grenada and to the SGU business model. But I think also having an affiliation with Mount Sinai, such a world-renowned institution, also offers a very exciting opportunity now for SGU, who has always been committed to working with the government of Grenada to create a teaching hospital. So there's, again, we are all working together. These various dynamics are being discussed amongst the various parties and stakeholders, but it really offers, I think, quite an excellent new opportunity for SGU to even envision its own business model and expansion and opportunities to grow along with the development of the new state-of-the-art hospital, teaching hospital, research components, and then even the broader medical city will offer even additional attractions to the SGU proposition. So I think from SGU's perspective, as well as with the government, there's a lot of exciting additional opportunities just for the relationship between the government of Grenada and SGU.
Mm-hmm. Now, I think the big elephant in the room here, or perhaps in the context of Grenada, the donkey. We don't have elephants in Grenada. We have donkeys, though. The elephant in the room here, ladies and gentlemen, has to do with funding this project. Now, will Mount Sinai be playing any role in helping to fund this project? What will be the cost to the taxpayer in respect of funding? And are we looking at raising funding? Of course, I know that for previous hospital, there were different hospital fundraising projects that previous administrations and different affiliated ancillary associations, so medical associations, whether it's of different groups, Kidney Patient Foundation, Nursing Association, they all engage in different types of fundraising. What are we looking at here in respect of funding? Of course, from the consolidated fund, we know that there will be some funds, but is it only coming from the consolidated fund? Where would the rest of the funding be coming from for this? This is a massive project.
Indeed, it's a very big project. It will be a huge capital investment for the government of Grenada. But of course, it's an investment in the wellness and health of our people. And so it is worth it. And to ensure that it's done successfully, we have very much considered how best to structure the capital required for the operation, as well as how will we maintain operations going forward. So from the perspective of the hospital, as we've said, it's a government of Grenada hospital, and so it will have to be financed essentially by the government of Grenada. Certainly, the government has already committed and set aside an equity component, as was announced in the budget speech. And in addition to that, we are now working very hard to find the best financing package for the rest of the construction of the hospital. So certainly that will include debt, and we have access and should be able to secure concessional level debt so that we are seeking the very lowest possible levels of interest rate with respect to the debt that we undertake for this project. But we would also, as you said, undertake fundraising initiatives, look for additional grant funding, and as well as donations, because this is a project that I think all Grenadians understand the need and understand what will be the benefit to each of us as we achieve this higher level of healthcare. So we certainly will be also launching a donations fundraising plan, along with our grant continuing to seek out grant funding, along with, as I said, the concessional debt and government equity.
Mm-hmm. Mr. Dolland, did you have any ideas in respect of funding, and what ideas did you propose? to the team for funding this?
Yeah, so following up on what Ms. St. Bernard has mentioned, yes, we have specifically looked at various types of debt. We've broken it down and gone into a lot of detail. We've also studied the models that have been used in the region, from the new hospitals being put up in Guyana and Trinidad to those done around the world. So we are very familiar. We understand the sources of that capital. We have access to a lot of that capital. But we're just right now in 2025. It is our goal to come up with the right mix that allows us to minimize the financial obligations and to maximize the benefits to Grenada and the people of Grenada. In addition to that, we are also engaging with the best philanthropic engines around the world who have raised a lot of money. And if you look at it, you look at a lot of the U.S. institutions, and
Sikapin, you said which philanthropic organizations have you engaged?
So, for example, I'm not on the capital raising side, but in terms of the academic institutions. So we're talking about large U.S. Academic institutions that have raised literally billions of dollars of funding. And so we are working with them to understand their models and to also to replicate not only a once-off fundraising capital campaign project, but to be able to have a sustainable project, sustainable capital raising campaigns similar to what is done in the U.S. to make sure that this hospital medical city is sustainable and not just focusing on the initial build of the hospital.
Okay. Mount Sinai, of course, as I said last week, some gave me fire for saying it, but I will say it again. First and foremost, Mount Sinai, well-respected organization, well-respected hospital in the New York City area. And I'm sure that Mount Sinai will not be in this for altruistic reasons because they love Grenada. I'm sure they do. They probably love the beaches and all of that. But the reason I'm bringing this up is because someone is asking here, and that's a question that I posed last week as well, where is the $2.5 million coming from to pay Mount Sinai in the interim in respect of what they will be doing now or what they've been doing now? Is that also coming from the Consolidated Fund?
Indeed, this is Government of Grenada paying, making an investment really into improving healthcare and ultimately putting us on a path for the journey to create a legacy of excellent healthcare for Grenadians. So yes, absolutely, the Government of Grenada is committed to making the necessary investments to see that happen. And the initial payment structure arrangements that we have with Mount Sinai is evidence of that commitment.
Very well. Now, I just want to go back to the investment question, because that is a question I raised with the Prime Minister as well in respect of CBI. Of course, CBI is big in the news these days. And the critique that I have of the CBI program is that it tends to be very heavily real estate driven, whether it's a hotel here, the monstrosity that we see, with all due respect to whoever is involved with it in Livera, whether it's a condo there, there, Of course, Mr. Duncan makes the point that, it's a lot of the CBI funds goes into the National Transformation Fund, which looks at other ancillary infrastructure projects. Has there been any efforts to use or leverage Grenada's Citizenship by Investment program, Ms. St. Bernard, which I know you will probably have an answer to this, in respect of this new hospital, funding for the new hospital? CBI?
So for the new hospital itself, as you know, the government has already made an equity commitment, and there's no doubt that a large component of the government's equity commitment will come from contributions made through CBI. So again, the National Transformation Fund, as you said, which is used for the government to determine what are the priority projects. So funding from CBI through that component will certainly contribute to the building of the new hospital. But what I think is more important or worth noting as regards CBI in general, you said it. So far, what we've had are a few good resort, hotel, tourism projects that have been successful in the CBI space. So where's the real investment opportunity as related to the medical city? Well, this is the medical city, and now we're moving from not just the hospital, so the hospital itself is government funded, but the medical city, 84 acres that needs to be built out. That is an exceptionally dynamic space for investors. to look at the opportunities available there. And so I think from a CBI perspective, what we would say is there are certainly project opportunities, and we would encourage private investors, local Grenadians in the diaspora, other interested investors to engage with us to understand what are the business opportunities for building out that medical city. And there's absolutely the opportunity for developers to then perhaps create an approved project that is a component of our medical city that then becomes a CBI product, for example.
Okay, very well. Now, when we think of healthcare, of course, as I intimated in the introduction, Grenada does have, say whatever you want about Grenada's healthcare system, we do have a very decentralized infrastructure, meaning physical infrastructure. So you have your district medical stations, you have your secondary hospital facilities, both in Maribor as well as in Carriacou. Back in the day, I was able to go to see my community doctor in PT Esperance, St. David's, as the Prime Minister's village. That's Dr. Rao. I think both the Prime Minister and myself shared the same doctor, community doctor. Of course, you had doctors who paid home visits and things like that. What would that look like under Project Polaris? Because we're hearing a lot about that medical city that is being constructed, but we do have a decentralized healthcare system. So is Project Polaris taking into consideration perhaps enhancing the infrastructure and the capacity at both Maribor and the hospital in Carriacou?
So certainly the upgrading and improvement of the healthcare system in general, from the primary care, the health centers, overall is necessary, and it's all part of the overall plan towards improving healthcare, the health system in Grenada in general. Project Polaris is specifically focused on the design, build, development, operation of the new hospital. And so I have to state the scope to that extent as you're referring to Project Polaris. But certainly Project Polaris works very closely and continues to collaborate very closely with the Ministry of Health so that we can understand and adequately integrate all the elements of improvement as we move forward on this journey. And certainly we are planning for and anticipating a lot of knowledge transfer to take place as we are seeking and receiving expert guidance on policies, structures, procedures, etc. In certain areas of the system, we will be making plans to integrate and share knowledge and essentially create a more comprehensive, better overall health system for Grenada.
Very well. Now, Mr. Dollar, is there anything else you wish to add? I'm sure that came up in the consultation with Mount Sinai.
No, that's 100% correct.
Uh-huh.
And so I think the one thing I will add is, just to really maybe summarize, we realized that to have a successful secondary and tertiary care institution, we have to have a strong primary health care infrastructure. And so these cannot be separated. It actually needs to be integrated. And that is one of the core principles of Project Polaris, one of the 5 core pillars. And that is a focus. But as indicated earlier, the delivery of that, the strengthening of that is separate from Project Polaris, but we are working in conjunction with the Primary Healthcare, Ministry of Health, etc., to make sure we share best practices and to ensure the system works holistically for all.
Very well. Now, finally, ladies and gentlemen, let us get to the site that would form the basis for the construction of this new facility. Several things, Ms. St. Bernard. I listened to the press conference after. I couldn't listen live because, of course, it's final season for me as a professor. So I'm here. I'm still in the middle of grading for what it's worth. But you did reference that a tendering is happening now in respect of identifying the suitably qualified contractors for the site. But even before getting into all of that, was there any EIA done on this new site? And if so, when was it done? When can we see the findings? And if it was not done, why not?
Yes, it was done. Mr. Dolan, can you speak to the timeline of the site work that's been done? Yeah.
Yeah, so we did the environmental social assessments, the ESIA, was initially done on the site in 2012 and was updated and extended in 2024. So that was critical.
Who did that work?
It was a local firm. I will. The name escapes me at the moment.
Okay. All right. But if I can get that information, would be good, because I would love to see the EIA. It should be publicly available. At least physical planning should have it. So I hope to see that, because that is a question that Mr. Gilchrist raised last week as well. So let us now talk about, let me just check my notes here, because I want to make sure that we cover anything. And of course, if there is anything that I missed that you want to add, I always ask my guests to add anything if we miss anything, because of course we can't cover everything in the short time that we have. Now, the 15-year arrangement, this big picture, long-term arrangement that you have with that you intend on having with Mount Sinai. There are two parts of this question. What benefits is it? What benefits does Mount Sinai receive from this? Is there going to be any sort of marketing benefit? Is the hospital going to be government of Grenada Mount Sinai facility? What comes out of this for them, for Mount Sinai, big picture? And the second part of that question is, I know that 15-year arrangement that you have, what measures are in place to ensure continuity should in the event or in the unlikely event that a government changes? What happens to that arrangement if, administration, because, different administrations have different priorities and things like that?
So the agreement is an agreement entered into by the government of Grenada, and so it is a 15-year agreement commitment by the government of Grenada. And as you know, when administrations change, it doesn't change commitments, legal obligations of the government. Certainly, a new administration might choose to make new commitments or change commitments, but the 15-year arrangement is a legal obligation on behalf of the government of Grenada, and so unless there is a termination or breach of that agreement, it would last for 15 years.
Okay.
The
benefits, marketing benefits.
I would say, so it was interesting the way that you.
Well, not only marketing, but other.
Yeah, it was interesting the way that you phrased that, and so I did a bit of a spin in my head, because to my mind, and really the reality is, the marketing benefit is to Grenada advantage. It's Grenada's advantage. And indeed, we do in fact intend for the hospital to be the government of Grenada hospital in affiliation with Mount Sinai. But let's be honest, who here has the good reputation for delivering excellent health care? It's Mount Sinai. And so what we are doing by entering into this affiliation is getting the commitment from Mount Sinai that they will work with us and that they're committed to seeing our standards raised to a level that they're comfortable being in affiliation and having the hospital named as being in affiliation with Mount Sinai. Mm-hmm. As I said before, one of the main goals of the collaboration and of the service, that measurable outcomes of the service delivery at the new hospital is to become JCI accredited. Again, that is the global standard of certification that will tell the world Grenada is delivering safe, quality healthcare. And there's no doubt that we won't be able to achieve that certification without excellent guidance and expertise to help us along that path. And the JCI accreditation, it's not a one-time shot. It's an ongoing, continuous, rigorous external evaluation process that is really going to ensure that we have the right policies, standards, procedures that deliver the outcomes that are worthy of JCI accreditation. And so Mount Sinai, starting today, is committed to working with us to get to that level. And they're so committed that they are willing to offer us the right, in fact, to market our hospital as being in affiliation with Mount Sinai. And so once we achieve this certified standard and we're clearly on a path of incrementally improving our service delivery, and we know we're getting to this global gold star standard, that really is the strength that we need to go to the market and offer health service as a tourism product in Grenada without having, with an objective standard of excellent healthcare certification to fly our flag. So what Mount Sinai gets out of it, really, I think Mount Sinai is a not-for-profit organization ultimately who has a mission to improve health systems globally for the sake of humanity. And in fact, that is what they are committed to doing with us in Grenada. Of course, we have to pay them a fair fee for the service and investments that they're making, but their ultimate goal is to see the health system in Grenada improve to a standard where they are proud to have their name on our institution, on our hospital.
I believe you're on mute.
I think I just muted myself there. I'm saying we'll take some quick viewer comments, but I want to respect you guys' time, and I want to thank you for at least agreeing to appear on the Bubb Report. I spoke to both of you, lady and gentlemen, privately in Ms. St. Bernard during one of your visits to DC. I asked you, when are you coming on the Bubb Report? Mr. Dolan, same thing in front of my old boss, Mr. Dolan. I believe that's your uncle. That was my old boss, one of the best bosses I had, I have to say. But you guys are here. So I'm hoping that we can continue to have those conversations as the project unfolds, because what we try to do here on the Bubb Report, our mandate is public education and doing deep dives on the issues that affect the national community. But let us get to some of the viewer comments. Viewers, again, audience, I'm sorry we'll not be able to take all of the questions, but we'll definitely try to filter out some that some of so that the folks can answer those. Okay, let us get to some questions here. Someone is saying JCI don't play in respect of in that accreditation, and I have a sense of what accreditation is a very nerve-wracking experience as somebody who went through it before at an academic level. But let's get to some other questions. Let's see. What would be the other components of the projects, particularly the areas that would be privately funded, be it through CBI or other funds or means?
So excellent question. And the rest of the medical city is open for discussion about opportunities from private investors. So that includes, it includes quite a bit. It's 84 acres. We are planning to have a residential component, a retirement community, a resort hotel segment, but also the medical city itself. So we would build additional medical infrastructure for additional medical services that can be offered and provided by private service providers. And so these are areas that it will very much depend upon investor opportunities. But also we have been doing research to understand what are the best opportunities for Grenada from the perspective of medical tourism and adding on other service availabilities. So it's a broad array of opportunities as we build out the city. And so there's certainly more to come in that space.
Very well. Someone is asking, couldn't the government partner with Mount Sinai to provide the necessary equipment for the existing hospital to provide the quality healthcare that Ms. St. Bernard keeps mentioning in the interim? Are there any conversations on capacity building in partnership with Mount Sinai in respect of just the physical plant and in respect of what's needed now?
I think that's a great question. It's all about timing. The biggest issues identified is not equipment. For example, currently in the hospital, we have great lab equipment, but this hasn't been implemented. We don't have the personnel to actually oversee the delivery of that equipment. So many times it's starting with the things that we could immediately transform. And again, that's the focus. It's a stepped approach and it's a measured approach. So it's not about getting the big MRI. Yes, that is on the trajectory, but it's about making sure that we're able to deliver the quality care, to have the systems and procedures in place that then allows us to then advance and upgrade to going into the more technologically advanced equipment. But for example, though, even in the current facility, we're looking at addressing certain matters such as mold, such as space utilization, such as medical records infrastructure. So yes, we are doing certain things currently, not only at the procedural level, but also at the physical plant level.
We have another question here. Well, not so much a question, but a comment. Mr. DeRiggs is saying the bottom line is healthcare is costly, and if a person cannot afford Eliquis, I'm not too sure what that is, for heart disease, and do not have insurance to stand the cost of the hospital, crap or smoke your pipe. I guess I think what Mr. DeRiggs here is getting at is a question I raised earlier in respect of how citizens will be able to access that quality of care that we need, that is so badly needed, quite frankly. And it's not so much so, yes, needing that care at the secondary stage, but I think it's also critical to make the point that primary healthcare is extremely critical. Doing your physical checkups, men doing your prostate cancer screenings without getting antsy about what the doctor is doing back there, But, all of these things are very critical in the context. And a lot of our health issues are lifestyle based, a lot of lifestyle disease based. So, ladies and gentlemen, I do want to give you an opportunity for closing comments, but I usually play a game here with guests who make first time appearances on the Bubb Report. I ask some quick icebreaker questions. I should have done that at the start, but I'm going to go. If you could have any superpower, what would you choose?
Woo. I mean, honestly, the first thought that came to my mind is sleep a superpower? Because I just need some sleep. A superpower, more time. There's so much to do.
Yeah. The 24 hours is just not enough. Mr. Dolan, superpower.
I guess to be able to predict the future, that would be a great one, because we'll be able to help us not only answer questions on the Bubb Report, but to be able to also be able to plan accordingly to make sure that this hospital and medical city are a success.
Okay. If you could change one thing about the way you were raised, what would you change? Is there anything about the way you were raised in Grenada you would change?
I had a pretty excellent upbringing. I had the beautiful opportunity to grow up in Grenada and spend a lot of time growing up in Grenada. If anything, I would say even more time in Grenada would have been my heart's desire. But I can't say I didn't get a lot of it growing up. So it was good for me.
Good. Mr. Dolan?
Unfortunately, it's ditto. It'll be able to have spent more time in Grenada growing up. Yes.
Okay. And finally, what's the last thing you completed on your bucket list? Anything on your bucket list?
I completed on my bucket list. I'm giving this to you. I took a tour across Italy, rode my bike for 2 weeks. It was wonderful last year. That was last year's bucket list. I'm looking forward to this year's.
I hope you did go to Sicily at least.
Florence, Siena, Rada, North.
Mr. Dolan?
Yeah, I'm not sure it's a bucket list, but my eldest daughter is getting ready to go to college. So I'm going to say that is an accomplishment.
Yes, of course. Absolutely. All right, folks, let us go over to you for some closing comments. Again, this was a very, and there's still more questions that we need to answer, of course, as this is a perennial, ongoing. Health is a perennial, ongoing issue. It just not stop and end, when someone unfortunately passes or, when someone dies prematurely or something like that. But, health is something that we need to continue to really be laser focused on. And one of the sad realities I have to say, is that, and that is, I'm a health communications major. That was my PhD focus, is this business of, our citizens having to do GoFundMes for life-saving and sometimes vital care. And it really breaks my heart sometimes when folks have to turn to that sort of crowdfunding measure to fund healthcare. And I'm hoping that coming out of all of this will be some form of affordable, equitable access to quality care. So on that note, Ms. St. Bernard, I want to begin with you for closing comments.
So my closing comments are that this is hard work. There's a long journey ahead of us. We need we need everyone to contribute to this process, and with the understanding it's for the good of all of Grenada. So I'd like to thank you for having us on the show. I think a very important part of this process is going to be keeping everyone informed as to what it is that we're doing and understanding where we're headed. So I've really enjoyed the engagement with you today, and I do look forward to the opportunity to continuing with these educational opportunities, as you said, because we do have another few years ahead of us before we even reach operation of the new hospital, and quite a bit that will be happening in this space between now and then.
Mr. Dolan?
Yes, I would like to start by saying, again, thank you for this opportunity, and noting that from our perspective, healthcare should be a right and not a privilege as it currently is in Grenada. And we're here to make sure that all Grenadians have access to quality, affordable healthcare. And in order to do that, we need to do that together. This is a bipartisan matter. And as the African saying goes, if you want to go fast, go alone. But if you want to go far, we need to go together. And so Project Polaris is leading the charge, but this is a large multi-stakeholder effort, including the Bubb report being part of that stakeholder universe. And we want to just make sure that we let everyone know that we are here to partner to make sure that Project Polaris is a success, both now and in the future for all Grenadians.
All right, Ms. Sen Bernard and Mr. Dolan, thank you so much for appearing on this week's edition of the Bubb Report. Viewers and listeners, we were just joined by Mr. Damien Dolan, who is, of course, the project, just let me make sure and get this, the lead consultant, that is, on Project Polaris, and, of course, Ms. Andrea Sen Bernard, project sponsor. And, of course, just on the question of project sponsor, I was educated on the fact that, of course, project sponsor, that tends to be used a lot in this healthcare space. And that was a teachable moment for me there. So I want to thank the both of them for agreeing to come on the program this week to answer some of the burning questions that we had. And of course, you audience, you will be the judge as to whether or not those questions were answered. And of course, we will continue to have that conversation. I'm telegraphing now that we also hope to sit with Mount Sinai as well as part of this engagement. So at some point, we do hope to have a Mount Sinai representative on the Bubb Report as we continue to have these very important conversations on the quality and delivery of healthcare services in the national community of Grenada. Folks, what we will do now is that we will take a quick break and come back with the second panel segment of the week. Please stand by for that.
Should your loved ones pass on, they deserve to be treated with dignity. And at S.A. Johnson Funeral Home, we can provide you with that service. We can take you every step of the way during your sorrowful moments. When that need arises, call S.A. Johnson Funeral Home at 347-777-9797. That's 347-777-9797. S.A. Johnson Funeral Home is a Caribbean family-owned funeral home here in Brooklyn, providing funeral services, but in a dignified way. From cremation to burial to the repatriation of your loved ones, you don't have to go through the hassle, as we provide exceptional service that allows you to mourn and heal peacefully. For more information, visit our website, www.sajohnsonfuneral.org. Send us an email at sajfuneral@aol.com or call 347-777-9797. S.A. Johnson Funeral Home, because you deserve to be treated with dignity.
And folks, welcome back to this week's edition of the Bubb Report. Of course, you know what we do here. We do ask for a roll call. We want to know where you're watching the Bubb Report from. So give us a quick heads up, a shout out as to where you're watching the Bubb Report from. And of course, we want to hear your comments in respect of the previous conversation that we had with Ms. Sen Bernard and Mr. Dolan. And of course, around the debate on healthcare in Grenada, it continues to be an issue. You know, you hear people talk about the quality of service or lack thereof that they receive when they go to the hospital, the capacity of care that they receive, you know, having to pay out of pocket costs for basic diagnostic services and things like that. And of course, we have to make the point that healthcare is indeed very expensive worldwide. Even here in the United States, when I go to see my primary care physician, I still have to fork out a copay. If I have to see a specialist, I still have to fork out a copay, whether that's $50, $100. So nothing really is free in the context of healthcare. And that is why the question of health insurance is so critical. And I'm really hoping that the government of Grenada would really give us some more robust answers in respect of how citizens will be able to afford the quality of care that government of Grenada Mount Sinai intends to dole out for the citizenry of the country, because health insurance will become such a critical component of accessing that quality of care that we need. So we wait to hear, in the wake of the cancellation of the GPA contract and by this administration, what will be happening in the context of primary the health insurance, national health insurance for the national community. Of course, we have viewers from Brooklyn. Anna Williams is in New Jersey. Bernadette Monroe is in Germany. Nelkel is in Brooklyn. Dale is in Mount Horn, St. Andrew. Diego is watching from Oklahoma. Diego, what time is it in Oklahoma? Is it Central Time or Pacific Time? You let me know. Keisha is joining us from Brooklyn. We have some other viewers again. We have another one from Brooklyn. Mr. Franklin is from Brooklyn. And Carvel Titus, Mrs. Titus, any relation to you, Raul? I don't know. Is that Raul? Did you get married and you didn't let me know you were married, sir? Well, she's watching from the USA there. Of course, we have Lydia James, a regular viewer, is watching from Toronto. So, folks, we're going to get into it. We'll get into the second part of this week's conversation. And from time to time on the Bubb Report, what we try to do is to make sense of the issues that has been animating conversation and debate in Grenada and in the national community. And I've assembled a very interesting panel to do this week. She's a returning guest to the Bubb Report. That's Miss Jenny Simon of Simon Says, the popular Simon Says program. Miss Simon, welcome back to the Bubb Report. We also have joining Miss Simon, a first-time guest to the program, Dr. Anthony Bridgman. Dr. Bridgman, I understand you're taking a quick vacation, a staycation, I don't know, but I'm glad you're taking time off your vacation schedule to sit with us on the Bubb Report, and it's good to have you here as a first-time guest. And of course, no stranger to the Bubb Report, no stranger to journalism, no stranger to the national zeitgeist. On some days, Raul is labeled as an NDC. On other days, he's labeled as an agent of Peter. On other days, he's labeled as an NNP. Raul, I don't know. I guess that's a good thing if all sides are trying to claim you. So, ladies and gentlemen, welcome to the Bubb Report. And what we want to do this week is have a conversation, because so many things happen in the news. And sometimes we think it's important to pause and have conversations on those issues. And of course, in the first half of 2025, several issues were in the news of significant importance. Of course, on the opposition side, of course, we have a new NNP leader and opposition leader. The NNP also announced new caretakers for the various districts. Of course, we have talk of the movement. We have the movement, and of course, we heard what Dr. Mitchell said about the movement and whatnot. Of course, CBI is big in the news as well. Of course, sadly, the Wello killing and issues of police accountability there. The delayed budget. Of course, we just had a conversation about hospital services and Project Polaris. Of course, the government announced new MNIB, Reno construction issues, oil and gas, so many issues. So I will give you a pick of the litter, Ms. Simon. Which issue do you want to kick us off with? Do you want to start with the movement? Because, of course, with you and Mr. Bridgman, you guys had a back and forth around your different views of your mutual friend, Mr. Peter David. So actually, let's start there. Let's start with the movement. And Ms. Simon, the disagreement that you had with your friend, Mr. Bridgman, on Peter David and his role in the political space in Grenada.
Thank you for having me again, Dr. Bubb. It wasn't a disagreement. It was my opinion. We good.
Okay.
We very good. Yeah. Yeah. So what do you want me to start? I think you should let Dr. Bridgman start, and then I'll come in.
Well, Dr. Bridgman, Ms. Hammond is giving you the chance to start, sir.
Well, good morning, everyone. And Dr. Bubb, thanks again for the invitation. And I have been on your program before discussing education, the education system in Grenada.
Yes, you were. You actually were. I do apologize for that. Yeah. Yes, go ahead.
Before I begin and answer your question, I just want to say congratulations to all our students from Grenada who have graduated with doctorate. I have never seen so many of our people receiving doctorate, and I'm so proud of that. So this is a season for graduation, and yes, those who have graduated with a postmaster's and bachelor's degree, congratulations to everyone. And your first segment, by the way, thank you for the questions you posed. Last week I wrote a piece on Project Polaris, and you asked some very good questions that people have asked, questions that are still out there. And as you correctly said, there are lots of questions that still out there. The role of SGU that you asked, the role of PAHO and WHO, the funding, among Sinai's role. Also, how do we fix in terms of the gap between now and that project? So thank you for asking those questions. With regards to the movement, I'm very proud to talk about the movement. Our politics in Grenada is very interesting. I think people are tired of the same old, same old. People are looking for something new that can take them somewhere. And we believe in the movement, in good people. We believe in good decisions and good governance. That's our core belief system. The movement stems from really the grassroots, that people asking for something new. As you know, I was a big supporter of the NNP because I really liked some of the policies at that time. But since the build up to the convention and what I saw in terms of the lack thereof of democratic processes, I came against it. I spoke out. I'm a professor of leadership, and I talk about the ways things should be done. And for me, if I were just to support it because I was a party member, I think, as I said, as I wrote, I would be intellectually, dishonest. So what was said on the platform during the meetings, during the build up to the convention about one particular member, and we all know it was about Peter David. So I said to people that we need to stop, because I believe in politics being something about growth and not necessarily eating our very own. So I'm a proud member of the movement. I write a lot about the movement. I listen to a lot what people say about the movement, what we stand for. We are very much in terms of inclusivity, bringing in anyone who wants good, as I said again, good people, good ideas. It's not about who is the leader and who's this, but it's because it's, again, the coming together and representing Grenada and saying that you have a voice to play in the role. You mentioned Dr. Kidd before I pass it on. I was a little sad what he said recently because I respect him very much, even though I may disagree.
I mean, he has said many things recently. What specifically are you referring?
I think he was asked about the movement, and he laughed and said, "The movement, they're moving. I'm gonna make a dance or something like that about the movement."
A calypso, maybe.
Yeah. I respect Doc, and Doc, as Eric Erickson talks about in the psychosocial stages of development, the late stage in talk about integrity versus despair. I want to see more integrity from Doc rather than despair. We want to see that mentoring. We want to see that coaching from someone who has been there and has done a good job during that time in terms of crisis leadership and all of that. We want to hear from more depth rather than those kind of childish and superficial stuff. This is all I got to say now before we go on this.
Is that the reason you're wearing that jacket? Is that an orange jacket there?
No, sir.
No, sir. Or maybe my eyes deceiving me.
What is orange?
Or maybe I'm colorblind. Is that the color of the movement? I mean, I have
this
seen.
This is a kind of brownish red. This is not
a brownish. Okay, not orange. Okay.
What is orange?
Well, Ms. Simon, I'll give you a chance to rebut to what Dr. Bridgman articulated, and I'll bring in Raul into the picture here.
For sure, yes. Well, I have to, and again, say to Dr. Bridgman, when it comes to being new, you can't align it with Peter David. What's new and fresh about Peter David? So I cannot understand that if we're looking for something new and fresh, you saying that Peter David is that individual. And then with the new National Party, with new and fresh people, we're not hearing anything about that. We have Nolene Thompson, we have young Christopher Dialli Jr., we have, I want to say we, I'm not meaning we as in the NNP, I'm speaking about just him, because let it be clear, I'm not the NNP, right? Well, let me say they, before I get into trouble for this we. They have.
I was just about to quiz you on when you say we here, you're a spokesperson for the NNP now.
The young lady Amanda Japal. No, that's new and fresh. That's new and fresh. And surrounding Peter David, there's no new and fresh. Really, the people that are the core people, they've been there 40 years. 40 years we speak, in the same amount of time as Dr. Mitchell that some of you condemn, and he must go when we had enough of him. No, that's the first part, the first item. Now then he went to the convention and the lack thereof of the democratic process, from what he saw and heard. Now I would like to know what that is, because he then spoke of we eating our own. There's a lack of democratic process there. That happens within all parties every day, whole day. Once you not liked by some individuals, they say the worst things about you. Now, to talk about Dr. Mitchell and him being, did you say childish? I guess that's what it amounted to, really. That's the same Dr. Mitchell that you just spoke about, the NNP, that you've been a part of and like the ideology and so. It's the same Dr. Mitchell. He has not changed. And I must come to say that what was done in the convention and what was said before during the lead up to, these are things that happen in all political parties, because it in the Caribbean, because it is it's an election. It is an election. And maybe you haven't heard it from, let's say, the head of the party, per se, but these, and out in public, I may dare say. But it happens. When Nazim Bubb, when Tillman Thomas was about to step down, he endorsed Nazim Bubb. He endorsed Nazim Bubb over Frank Bernardine. He didn't do it in public, like, and behave like Dr. Mitchell, but that's two different individuals, totally, right? My question is, if Dr. Mitchell had gone on to endorse Peter David, would we have been here today saying these things? Would we? No. Right now, you, Dr. Bridgman and Peter David and they would all be happily in the NNP. Would have all been happy. And it's a case of you didn't get what you want, so you move on. And that's nothing new with Peter David. Well, in the case of NDC, they threw him out. But he could have formed his own party then. He could have formed the movement then, but he went inside the NNP. And at that time, they were very far apart in ideologies. And they said Peter David, and they at the time being fresh in the NNP, in the NDC, with Ali Gale and the others, they're the ones, and they said the worst things about each other. Dr. Mitchell and Peter, and then he left when he was thrown out of the NDC, straight into the lap of the NNP. I think I saw in one of your publications, you said you went to the NNP with Peter David. I saw that in one. No,
well, but to be fair to Mr. David and to the NNP, in fact, history would show that he was invited into the NNP by Dr. Mitchell as well. So it's not that, he invited himself into the party.
Agreement. I don't know the agreement, because I'll tell you something though, even when Mr. David was in the NDC, there were persons who didn't trust his, whatever the relationship was, because apparently there was one with him and Dr. Mitchell all the way, even then. So I don't know what the arrangement was. All I know, he ended up into the lap of Dr. Mitchell inside the NNP. I don't know who invited who. He didn't have to accept though. He didn't have to accept. He could.
Well, fair enough. Mr. Bridgman, I'll give you a quick right of reply, and then I'll bring in Brother Raul here.
Thank you, boy. We started off very hot, man. That's really good. Jenny, you came with your notes and all that. That's good stuff.
I took notes while you were speaking.
Well, okay.
I'm at that age.
Let's go back to some of the things that you said. You made mention of a few things, and I want to kind of unpack it a little bit. The first piece you talked about with regards to Peter and nothing new, and you compared it with the new people coming in from the NNP. Newness doesn't also mean just the person, Jenny. Newness is also about ideas. Okay, you can have a whole lot of new people with the same old stuff, and it doesn't go anywhere. So that's one fallacy that you have that I need to debunk. Newness is about ideas. Newness is about listening and realizing the role of leadership also. So yes, NNP has, and congratulations to them, a lot of young folks. And I wish them well with that. The same piece you said that with regards to the build-up of the convention. My view of leadership is not the leader, not the political leader coming out and taking sides. I look at leadership as creating an environment of equity, inclusion, and access, giving people the opportunity to be themselves. Okay, not you taking sides. So you asked a question whether or not if he had come out for Peter. I wanted a fair process. As a matter of fact, I was one of the few people early days, and Mr. Spear can tell you that, who encouraged her back in the day, not now, when they were in power, to step up in terms of a leadership role. So I want to see fairness, Jenny. The other piece you talk about with regards to Dr. Mitchell being himself, he has not changed. Okay, and it's difficult. One of the words being described about Dr. Mitchell by his own people, that he's very stubborn. And yes, he is. He may own that. Okay, I disagreed, and I didn't like the way it was done. I didn't like the way publicly saying things about another. That's what I talk about, eating your own. I have not seen that in Caribbean politics. Okay, if someone, a member of your party, is vying for a position, I have never seen any political leader coming out in public and say stuff. You need to campaign. You need to compare and contrast ideas. We expect that. But that's not what happened. So that's what I'm talking about. I rest my case here. Thanks.
Raul, let us hear from Raul a neutral perspective on this movement. Raul, that is something you've been covering as well. What say you on all of this?
Well, good morning, everyone. Good morning, Dr. Bridgman. Good morning, Cousin Jenny. And
Dr. you all are cousins. I didn't know that.
I always call her Cousin Jenny because I admire her. I don't know if she was trained in journalism, but I don't care what her politics is, but I admire what she does. She brings out a lot of good information, and she
or maybe she has people around her that was trained in journalism. Maybe that's the case. I don't know.
And sourcing and networking is a critical part of that. So she gets a lot of information out there, and they're even afraid to contest her. So I applaud that. And I think in response to what you said at the top of your comment, and I understand why today some people will say I'm NNP, tomorrow they'll say I'm NDC or movement, whatever. And for years, over 20 years, that has been an issue. I have no problem with that. It's because I gravitate towards a good idea and a good person. So today, I'm one who can say publicly that Dr. Mitchell arguably has done just about the most for Grenada in terms of pulling us out of a lot of crises. And like Lou Smith, I've been in tongue long enough, so I know. But I can equally criticize, not personally, not a personal attack, but criticize his policy positions and some of his comments. And I do criticize the way he handled the process in terms of the NNP election and some of the comments he should be making. And I do feel as if he sabotaged his career and so on. So but I do respect him. And I could gravitate to like I like what Laco was doing before he was fired. I like what Tanti Glow and Delma is doing in terms of unity politics and so on. So I can gravitate to those things. Emlyn Pear, as NNP, has been doing a lot in terms of the youth movement post the revolution, and she hasn't gotten the kind of credit she should get for that. So whether it's yellow or green, I tend to gravitate to what I see is good. All of us are imperfect. All of us have imperfections, but I tend to gravitate to what I see is good. A good idea I saw was, I think Peter David, under a previous NDC administration, had floated the idea of the diaspora committee, and even a senator in the diaspora representing the affairs. You know, the interaction now. Social media has brought us together, the Grenada and the diaspora. And I'm linking that now to what is playing out with the new hospital. No, what I want to say about this, and I know you study hospital administration as well as I do, and there's an issue in hospital called cultural competency. Now, Mount Sinai is essentially a private philosophy operation, right? In Grenada, we have basically a public setup and a population which requires a public setup. And I feel that more consultation has to, and let me applaud the government. The initiative is good in terms of what the intention, but we want, in my view, we need some solutions now towards services problems, things that we happening now. And I would like to see a more organic effort in terms of the government meeting with people and meeting with sectoral organizations to come up with solutions, services to deal with existing problems in the healthcare sector right now that are not seen. We have this tradition of that it's always a foreign person and a white person to come down and tell us what to do. And we are replete with examples of solutions created for us to do, from disaster management to whatever, and then we put it on the dust or on the shelf, and then 5 years later, somebody come down to tell us what to do again. So my feeling is that I want us to consider the fact that in terms of cultural competence, we're dealing with a lot of people here in Grenada who cannot afford healthcare by virtue of employment, by virtue of inability to pay. So health insurance, and you mentioned it, Dr. Bubb, I think a couple other panelists mentioned it, I think Dr. Anthony Bridgman mentioned it. How,
as well as Mr. Gilchrist last week as well.
Yes, we have to focus with the same level of enthusiasm on healthcare insurance. How do we pay? St. Augustine last week had this big thing where they had the MRI, the new MRI, 1.5, T1.5. They didn't come with the T3, which is bigger and probably more costlier, but also has risk implications. Nonetheless, they unveiled MRI T1.5. Now, you know what it will cost for that? How many people can afford that? This is a barrier to healthcare. So we have to look at removing the barriers to healthcare, because when we look in the parameters of the social determinants of healthcare, cost is a barrier. Education is a parameter barrier, because based on your education, it determines your outcome. Where you live, your education. So those things have to be, in my view, examined. And I think at the ground level, at the community level, at the people level, I would like to see a greater input. And it's interesting because the biggest healthcare provider in the world, in New York, has more West Indians and Caribbean people. The CEOs are Grenadians, Guyanese, Trinidadians. And linking that to the diaspora, it's unfortunate we're not at the maturity level with that idea from Peter in terms of this diaspora and Grenada, where we could connect on that level, where we can tap into the expertise that exists in the healthcare level. There are so many people at top levels doing so much good in the healthcare sector in the US that can contribute, that will understand the cultural competence that's needed and the services that needs to be provided, and the enthusiasm to ensure that, hold on, 80% of the people, 90% of the people can't afford certain things. So you need, as a matter of urgency, health care insurance so people can pay for those services.
Yeah. And thank you all for that important segue. And I want to bring in Ms. Simon here, because on a previous episode of the Bubb Report, we did speak with the JIPA consultants who actually were in the process of developing that NHI. In fact, they created a model and everything. In fact, I believe elements of that model was implemented in neighboring St. Lucia. So again, for me, the critical question here, and of course, you lady and gentlemen heard the conversation I had with the Project Polaris team here, is so much so about not only how we are going to fund the construction of this new hospital and the services that would come with it, but how would people be able to afford access to the quality of care that Mount Sinai is reputed? And I also have, Raul and panel, I also have this qualm with Mount Sinai as a quote-unquote non-profit. I cannot walk into a Mount Sinai hospital and get free care without receiving a big bill. Yeah. In fact, a Mount Sinai ambulance would not come to my house if I have a medical emergency. Of course, that happens across the board in the US. There is no major hospital in the US that operates quote-unquote not-for-profit. It does not exist. So, Ms. Simon, on that question of Project Polaris, what you heard this morning, and of course the government, they precede this Mount Sinai Project Polaris announcement by saying, big announcement coming. And I thought that was interesting. But of course, I think, to be fair to the government, is also important that that something be done about healthcare, not the future healthcare, but current healthcare as well. Ms. Simon, what say you on Project Polaris?
And I'll start at the end with being affordable or not affordable. And that's why I was very astonished when I heard Mr. Donald's closing remarks when he said, healthcare is not affordable in Grenada right now, but insinuating that with Mount Sinai on board, it will be more affordable. I don't understand the reason, and probably we needed some explanation from him why this would happen, that it would be even more affordable then. I did speak on one of my episodes, one of my latest episodes, about this insurance. I mentioned that because hearing about Mount Sinai coming to Grenada, we know that Grenadians would need health insurance, and even the ones who probably can afford it now would not be able to afford it without insurance coming. So it would all boil down to a handful. Again, as we see here, it's been happening. It's always a handful that benefits from the best, that gets the best. As to the big announcement, well, let me say, Raul, the media didn't take it up as a big announcement because only 3 media personnel showed up at that press conference, and which was very sad, if I must say so, that they did not show up to the big announcement to come. And my worry is, even as Ron mentioned the MRI, I think it was something like in the vicinity of $5 point something million for that equipment. That's like 4 payments for one Mount Sinai payment for the year, right? 2.5 million we paying Mount Sinai for the affiliation. And if the general hospital, it could have in 1 year, then could have purchased an MRI for the general hospital, where it'd be cheaper for the ordinary man to probably access it. We all know St. Augustine is private, and so we don't have we have no what's the word for what they do with their pricing, right? That's theirs, they're private. So 4 payments to get that MRI, that the general hospital, that they pay in Mount Sinai in 1 year, out of the consolidated fund, if I might add. As I heard Ms. Bernard said, it's coming from the consolidated fund, from a government that had to borrow $825 million to sustain the last budget, right? For a country that is covered in bushes because we don't know what happening to the debushing program. Just this weekend, I've been hearing of some teachers that had not been paid over the last 2 months, right? One teacher in particular, who takes care of a sick mother, had to borrow money from the school's coffers so that she can pay her bills and do her errands, take care of her mom. So when she get paid, she can pay back the school, right? And we are paying. You see, I have no issue with a new hospital, but I have an issue with priority. And at the moment, we have a hospital that just needs to be run properly from administratively and to come down, right? And materials, equipment, whatever. Let's start there to save lives. Almost every week you hear of a young mother who either lost her life or her baby. But baby's losing. So you see, my issue is not about, oh, we don't need a new hospital. No, but the priority now for me is saving lives, and especially the ordinary people who can't afford to jump an aircraft and go away for medical, who weekly pass around on a truck with a cup begging to save their kids' lives.
Yeah.
We need that now.
And it's just not sustainable. Dr. Bridgman,
if you can pull up $2.5 million out of a consolidated fund at the moment to start paying Mount Sinai for the first 5 years, something is wrong with the math. Something is wrong with the math.
Yes. Dr. Bridgman?
Yes.
I suspect that there would be points of agreement between you and Ms. Simon here.
Health, again, I think all of us believe that we need to do something with our healthcare. Governments try the best to do stuff. It's not working. I'm a supporter of what the new government is trying to do, but there are still lots of questions, that unanswered questions. We are asking for transparency. Yes, there needs to be something done currently. Our current reality speaks of we need the necessary help in the hospital. Grenada has suffered from a brain drain for a long time in a lot of our areas. You talk about education, you talk about health areas, there's a brain drain. And this is why, Jenny, the movement has a policy on health. Yes, we have a very strong policy on healthcare. You mentioned the national health insurance. This is something that we are advocating for. We are advocating
but Dr. Bridgman, I'm sorry, a national health insurance plan already exists. How is that different from what is already under Peter David's previous NNP administration? Because he was in the government when all of that, his comrade Chester Humphrey was part of that NHI program. So how would that be different?
Well, what's happening now, Kellen? What's our current reality now?
Just go ahead, sir.
Dr. Bubb, what's our current reality now? Is it happening?
No, it's not, because it was canceled by the previous administration.
So again, we look at
this current administration. Sorry,
right. We're looking to streamline it. We're looking in terms of community wellness pieces. We're looking into nursing education and all of that. The issue, as you mentioned in the first piece, with regards to, you may have all this equipment, but the specialists, we need the people to do those things. Again, we'll go back to the brain drain, that where our specialized people are moving because of better pay and better services. So we have to really look at our system and do, like, we know there's a needs assessment there. We know what the problems are, and to fix it. And governments come, governments go, and we talk a lot about doing certain things, and it's not done. This is why the people don't believe in what we're saying. Healthcare is expensive. One of the key pieces that for all of us outside of Grenada is, when we retire, what's our healthcare package? Okay, how much our organization is willing to pay for healthcare. One of the things people are looking for Grenada in terms of retiring and coming back, the healthcare system. So yes, it may be expensive. It is expensive, but we have to ask the right questions, and I think we have to go forward with effective plans to make sure that our people are being well served and taken care of health-wise. I strongly believe that, even though we may have questions about it. Yes, I agree that we have to build, improve the gap from where we are right now until this new hospital is being built, but we need it. Yes, we need to improve our current facility, but again, look at where our current facility is. We have a lot of problems there. So let's not just look at it and say, okay, because of this new government, we're going to throw it out, the baby out with the water out. We need to work on a lot of our systems and improve our systems, and the healthcare is one of the areas that we have to do more work on.
Now, sticking to public administration here, and then we will veer off into law enforcement, national security, and some other issues. And that has to do with some announcements that the government made in the first half of 2025 one of which was, of course, the announcement of a new MNIB entity, that private-public partnership. There was a town hall in which that announcement was made recently. And of course, you also had the oil and gas working group there making an announcement against the backdrop of the announcement that was made by the newly incoming Prime Minister of the Republic of Trinidad and Tobago, Kamala Persad-Bissessar, in which she made this claim that, Grenada probably has more natural gas resources than the Dragon Field, which is, of course, the area in dispute between Trinidad and Venezuela that's under sanction by the United States. And I was saying to myself, well, perhaps Dr. Mitchell feels vindicated in his whole "we have oil" announcement, because here we have Kamala Persad-Bissessar saying that she now wants to enter into arrangements with the government of Grenada, and it's an announcement that the Prime Minister welcomed. Raul, I want to begin with you here. Is this just another red herring? Is this just a chasing of these elusive oil and gas goals here? These announcements on oil and gas here. Are we politicizing this? Are we continuing to politicize this here, Raul?
Yeah. Well, my big first response to this is that we have been focusing more on the politics around this oil and gas issue as opposed to the oil and gas issue itself. And the politics, and I'll criticize from both sides. Dr. Mitchell announcement, that pre-election announcement about we find oil and gas, whatever, to the current administration talking about you're looking for documents when the documents there. That's politics. That's politics. One, to make one side look bad, to make sure you get in, to get an upper hand, an unfair upper hand. And if you focus less on that and focus more on, tell us what is there, what is really there, what's the whole deal, what are your plans, what are your expectations? There's a committee now headed by Mr. Burke who has to do review and tell us what the details are and where they're going. It shouldn't be knee-jerk responses. The new Trinidad and Tobago Prime Minister make an announcement and now all Grenadians' head and ears pop up, and then you have reactionary comments. There are too many comments around the core issues. What's the deal with the Nigerian who would have supposed to have signed Ocean Gate with the current administration? I'm hearing quota how much, 1.8 billion or something like that. How would that play down on the ground for us as Grenadians? How are we, what's the details? What's the brass tacks of these things? That's what we need to know. We need to know what exists. We need transparency on this process. Oil and gas, how are we what do we have? How are we benefiting? How are you proceeding with this? It's just a lot of talk around the issues for everybody jostling for political currency, for political advantage, and that's the focus. And that's not good enough.
Mm-hmm. Ms. Simon, Raul is saying that's not good enough. Do you agree that it's politicized? All sides are doing it. Of course, we heard Mr. Bowen as well when Prime Minister Deacon Mitchell came out to say that there were no files found. It also reminded me of the announcement about the alleged donation that was made to the South St. George constituency office. I'm still waiting on that cabinet conclusion, and that's why we need a Freedom of Information Act, by the way, as a journalist speaking here. But Ms. Simon, on that question of oil and gas, is it too politicized? Do you agree with Raul here?
To a point, it is politicized, but how do we get away from that? Even it being politicized, we need to hear from the government that's in office now, the administration, and we're not hearing from them directly as where we are, what exactly is happening, right? We're not hearing. We, to use the Prime Minister's word, they corralled the people down to the trade center and to play Ring a Roses. In my mind, that's what Mr. Burke played. Ring a Roses. He don't want to say that there is oil because that would give Dr. Mitchell credence, and so he stepping softly, pulling back, pushing forward, and it has become political there as well. And in my mind, that oil and gas that raises head now with the ruling administration, it is political and tantamount to what they said Dr. Mitchell did in polls. This is an election coming, and we are going to do it better. And even down there, they talked about the announcement in Pearls. They have to bring it up, that the announcement in Pearls, and it was an election gimmick. Well, what is this? Because we're not hearing anything further, right? We know that there's GPG there that had a 20-year development agreement with the government of Grenada, 20 years. I think they probably still have 8 to 10 years left with the COVID and whatever. I don't know if they do subtractions. I'm not sure what it is, but at least 8 years left, right? And we're not hearing anything positive or anything that includes GPG when this administration speaks, right? We're not hearing GPG at all. It's like they're ignoring GPG and trying to bring in other people, which is just going to take us to arbitration at the end of the day. I don't know if we could afford another one, right? So we're not hearing about GPG. We're not hearing if we have or we don't have, right? Up to now. They're saying that there's something there because they just don't want to say that, yes, we might have gas and what Dr. Mitchell had said, because in my investigation, what I heard was that what Dr. Mitchell announced came from the GPG and their exploration license when they did whatever exploration they did, right? He might have elevated it. He might have exaggerated because yes, it was elections.
He did exaggerate it. He did not even give credit to GPG when he made that announcement. And I remember I was cussed out for saying that was too political around the election time by some Peter David elements. But I would not go there, Mr. Bridgman, Dr. Bridgman.
No, Dr. Bridgman and Ron. No, you bring me. I had to come back to you on that. You bring me here to come up against two the movement people, and every chance Dr. Bridgman gets, he's splicing the movement as if he's advertising here now. And I thought I was coming. You said, and he's under his name there as a commentator, and he's saying we, and I don't know who the we are, but little people
just say we in describing.
And as of now, there is no the movement party in Grenada. Everybody, I am Jenny Simon, and I am a Grenadian, and I am the movement. There's no party. So who is the movement? And to talk about the insurance and the movement have their policy. Now, Peter David and they go parties back and forth. Peter David was a part of both parties back and forth. And what was his policy then? No, you see, the Net Brothers, the company that was doing the insurance, and if I might say so, I wouldn't even say perceived, but let me say perceived to be safe.
Can I get a word in, Jen?
Supporters, right? And the NNP employed them. No, that's inclusivity, right there. The NNP, NDC fired them.
Let Mr. Dr. Bridgman get a word in.
Let me get a word in, Jen. I see that my comments and speaking to what my core beliefs are getting to you, but it's fine. Let me just go back to the original question that were asked with regards to we were talking about the oil and gas. This is a problem with our politics. As Sengi says in his writing, The Fifth Discipline in Organizational Learning, today's problems come from yesterday's solutions. Both parties are doing the same thing. In 2018, it was electioneering piece by Dr. Mitchell. We all know that. Now it's similar, same thing. Okay, we have to get to the point that it doesn't matter what the situation is, but if it's of benefits for Grenada, whoever gets the credit, once Grenada gets the credit and the people's lives are being positively effective, that's what we need. And that's the challenge with all politics right now. For example, when NNP was in power, NDC criticized them on the CBI. We know that. They criticized them on the upgrade of the airport. Okay, they're in power now, and they're doing the same thing. NNP's out of power in opposition. They're criticizing some of the things that they should have done. We know that that's how our politics is in Grenada, and we have to move away from this. This is why, Jenny, I speak about a movement, because it's something of a paradigm shift within our politics.
But
so
we
this
don't know who that is. We don't know who that is.
You will know.
I think Dr. Bridgman, to be fair, I think you've just declared your hand, because I don't think you've ever publicly said that you're officially affiliated with the movement. And by the way, speaking of movement, since you are now publicly affiliating yourself with the movement, I understand that a new symbol was passed in Parliament. I believe it was a dove or something. Is that the symbol for the movement, Dr. Bridgman?
I'm to be honest with you, I'm not aware of the intricacies of those things with regards to the symbol and all those kind of stuff. I have not been focusing on that at all. That's not my thing.
But is that something that the movement has been focusing on? And what is your specific role there?
Dr. Bubb, as you know, in any organization, there are different, as a gestalt, there are different parts that make the whole. My focus is on policy, looking at policy and how researching certain things. So in terms of what other sectors are doing, yes, people are working together, because the movement is not just one person. This is what I said at the beginning. There are lots of different parts of it. So something passed in Parliament with regards to Grenada and Caribbean politics, you must have a color for certain things. But my philosophy and the movement, what we talk about, is moving away from the color that represent and stigmatize people in the Caribbean and Grenada, that you are this color and that color. I'm not a supporter of those things.
Okay, right. So maybe you can go with a neutral color, white. Well, except of course that's Uncle Gary's color. I don't think you can.
Movement is orange. They came before they even have a party. They have a color. The first thing they have.
But Jenny, you said that the movement is not a party as yet, and there's a process, Jenny. It's not an event; it's a process.
You're saying we and the policies, and you're explaining about the NIS, the health insurance, and so that's what I'm asking. Who is that? Because we don't know. What are your visions?
People who are working towards studying and researching.
Yes.
You will see it in time. I'm waiting for the new ideas of the NFP.
Dr. Bridgman and Ms. Simon, I would invite you all to Umbrellas for a separate conversation.
Jenny's my girl. We'll do that. Jenny's my
very
girl.
well. But let us go on to talk about now that there have been issues raised around the electoral office. That has been a salient point. And Roll, I want to begin with you here on that one. I'm not sure if you've been following that story. Now, the opposition accused the electoral office of not really engaging in proper supervision of its returning officers, owing to the fact that one of the returning officers, I believe from Carriacou, was seen at a partisan political meeting of the ruling administration. I believe a women's arm meeting or whatever that was, in addition to the implementation of this new digital voter registration, voting infrastructure, which I believe was ostensibly budgeted for but was never implemented. And there are other issues around registration processes and what that looks like. So, Raul, is that an issue you've been following?
Yeah, I don't know all of the details of it, but I know there's a lot of concern about the elections office. I know the opposition leader, Eminent Pear, has raised this a couple of times. I know Mr. Pear, the supervisor of election, has talked about the outdated equipment, and the company that makes the equipment no longer exists. And he also says that they have to replace this equipment. He didn't give a timeline. And as last time I checked, the equipment has not been replaced. The opposition leader is complaining that people cannot register. You add the names to the addendum. That is not happening. So anyhow you slice it, there are some serious fundamental issues with that process, and it should not be happening, because people have to be able to participate in a process that's free and fair and without any obstacles in the way. If people have to register, they have to register. If people have to check, they have to check, and the process should be fixed. So there's some serious fundamental problems with it, even as confirmed by Mr. Pear himself. And it has not been solved when last I checked. So that is an issue. That is a current issue as far as I know.
Now, Ms. Simon, I understand that you were part of a meeting that the Electoral Office held with members of civil society. I believe the grouping of civil society organizations attended that meeting, as well as yourself. So can you articulate what that meeting was called for and the outcomes? Yes,
I was
go
part
ahead.
of the last couple of meetings. The first meeting, it was an answer to civil society banging at the doors, and he finally answered and had that meeting where a wide range of issues was discussed. And one of the things that was discussed was the equipment, the old equipment, not being sustainable anymore. And as both Mr. Pear and Mr. Millett, the IT personnel, agreed that it can break down anytime. In fact, it has been breaking down over the past few months for a couple of weeks at a time, and they've been patching it up literally because, as Raul correctly said, the company has gone out of business and you can't find parts and nothing. It's gone, right? So at that meeting, the electoral, the supervisor, he said clearly that the terms of reference has not yet been drafted, and therefore there's no tenders out for that equipment, right? He also agreed at that meeting that it's going to take more than 2 years to purchase, try out, implement, figure out if everything is okay, and then re-register, because they cannot use it, they can't go parallel. So you cannot use the old system and the new system. We all would have to re-register. We're in a third year of an election cycle. We have 2 years left. And they don't have that equipment in their position as yet. Right there, we're in trouble. Now, he said also at that meeting that if time is an issue, then we would have to go with the old one that's breaking down every other day. We'd have to go with that old equipment. Something is wrong there, you see? So after that meeting, in a matter of days, he called the next meeting saying to talk to us about the new equipment, right? And I guess his wording was really wrong, because we went to that and all we were told by the IT guy, Mr. Millet, is what the new equipment should entail or will entail. Explain to us, what would have to happen and all of that. There's no equipment here on Ireland. But what we gathered from the letter, what the letter basically said, they called us to talk about the implementation, right? And that's why I said, well, it had to be purchased in haste, because if 2 days ago you didn't have it, how you get it and ready to implement and all of that. So his wording was really wrong. And if I must say here, of course, I'm going to say it, that just listening to Mr. Pear, he don't have a clue. He was pelting there.
And that is Mr. Arthur Pear, who is the new supervisor of election.
Yeah. Right? And he is obviously going along with what he's been told to do, or as we would say, is basically a rubber stamp. Because to talk about the lady in the electoral office in Carriacou that been attending, and it wasn't just the woman's arm. She was in another political meeting with the colors. And the opposition leader of Emmeline Pear, she wrote to the Governor General about it. And the supervisor of election is saying he's going to transfer her. Where are you transferring her to go? To Trinidad? Because she is in Grenada here. Grenada, Carriacou, and Petit Martinique is a state. Where are you transferring her to go? She needs to be removed. She needs to be removed and not transferred, right? And these are the things that you look at and wonder, what is really going on with the electoral system? And that is a very, very, very serious matter with us, that an election can be called any day now. We're 3 years in. And you hear utterings of that. It may not happen as well as it can happen, right? And we have a system that is breaking down, and you telling us that we might just have to use that system in the interest of time. Mm-hmm. It's some serious. It's a serious problem.
Yeah, and I just want to, as an addendum here, I just want to add to what you just articulated with respect to what the grouping of civil society organizations said in a press release. And let me go ahead and share that screen here. Let's see. No, it's not. Let me stop it. But let me just quote from the press release. It said this of particular concern. A coalition of civil society organizations expressed significant concerns regarding the transparency and accountability of the Office of the Supervisor of Elections, led by Mr. Arthur Pear. The CEOs reported difficulties in engaging with Mr. Pei on electoral matters, culminating in a meeting on the 22nd of April 2025. During this meeting, Mr. Pei acknowledged being unaware of the issues raised and committed to providing a detailed report within a week, a commitment that remains unfulfilled. Of particular concern, they said in a press release, is a sudden shift from discussions about initiating the procurement process for a new voter registration system to an unexpected invitation for a meeting on the 8th of May to discuss the implementation of the identity document issuance system. The abrupt change contradicts Mr. Pei's earlier statements and has raised questions about the integrity of the process. Of course, in all of these conversations, I've heard from the opposition. I've not heard from the government of Grenada per se. Well, not the government per se, but the National Democratic Congress, who are stewards of the ruling administration. But Dr. Bridgman, is that a conversation that you've heard or you've been having?
No, I have been following the news, and I saw the Mr. Spear, opposition leader, mention this. And if it's true, I think this is a big problem. I think we really have to clean up our politics. The idea of political appointees in position and people wearing the colors, and this is a public sector. I really believe that we need to really fix this. My bigger concern, I think, questions were raised about the diaspora, people voting. I really think that I'm a serious person with regards to voting in elections, and if you're not registered and the procedures or the laws, I think you should not be part of it. So I'm really interested in hearing as to people who are coming from the US and other places to vote in Grenada. I'm doing some research on that as to what past administration have done with regards to this and who is entitled to vote in Grenada's election, because I know it says about...
Well, you have to meet a particular residency requirement, so you just can't jump a JetBlue flight a week before election and go and vote in Grenada. There were allegations that the previous administration did that. Now there are allegations, the previous...
Yes, that's what I'm saying.
Ruling party, now there are allegations that this ruling party might be doing the same thing for this election.
Yes.
So honestly, I think it honestly comes down to a matter of enforcing the laws that are already on the books.
That's right.
Ensuring that your poll watchers are able to trust and verify that Ms. Eliuta, who lives in Laborie or who lives in Labo or in Pomrose, actually lives in that pink and yellow house that Ms. Eliuta lives in, and that Ms. Eliuta doesn't live on a Flatbush Avenue in Brooklyn and came down to Grenada 6 weeks, not even 6 weeks, maybe 6 days before an election, to say that Ms. Eliuta is voting in that election. So I think it honestly comes down to strict enforcement.
Yes,
and to the extent that the Electoral Office has been enforcing this in the past, I think the jury is still out on that. That needs to be strictly enforced. Raw, any thoughts on that aspect of it? Because, of course, you referenced the diaspora earlier. The diaspora is a critical element of Grenadian development. And, of course, there is the counter-prevailing narrative that those of us who live in the diaspora should be entitled to vote in the same way that Grenadians are entitled to vote. After all, we contribute to Grenada's national economy by way of remittances. But the current law does not provide for people who live outside of Grenada to vote properly. Yes, so Raw.
The common denominator here is this politics that we heavily depend on to build ourselves, to introduce our laws, to introduce our policies. It is this same politics that is undermining us, right? The complexion, the mentality of the person who sits at the top of the politics may vary, right? But at the end of the day, politics is affecting policy. And I say this across the board. And I don't know how we can fix it. I do not know how we can fix it. And it ranges from the issue of this voting where people come from the diaspora and vote and violate the 12 months, and the system doesn't kick in to spot, because the system is supposed to kick in to spot and monitor. But guess what? The same politicians, whether green or yellow, are the ones that's facilitating the process. And they have been facilitating the process over the years, right? Healthcare, okay, let's look, for example, at the Wello issue. Wello was gunned down by a policeman, right?
Allegedly.
Allegedly.
And Raul, I was about to say allegedly, Raul.
Right. Okay. So
the matter is sub judice, and I'm not getting sued.
Right. Protect you. risk management. The situation is this. A major festival is happening in St. Mark's, right? Is there an ambulance on stand? So there's police around. Is there an ambulance there because there's a crowd? Why do you think when we have big international football, CFU playing international football, there's a requirement? You have to check certain boxes, medical, and so on. The point I'm making here is that there's policy in Grenada, political governance, political policy has failed us time and time again. Disaster management, post-Hurricane Ivan. Okay, we got the funding through the Cedar Island project. We implemented a comprehensive system. We met with all the sectors, the people, and we had 3 specialists. So we revamped the community, 17 district disasters. So by the time Emily hit 10 months later, we had a structure. So you could know all what's happening. Fast forward to today, that system has collapsed. Policy has failed us. There's no continuity. We start something good, we do not continue. So it has failed us. And I can point to many other examples where policy, okay, national security, that's a topic you wanted to touch on. The issue of police and accountability, right? So when the police conduct themselves, who is monitoring the police?
Yes, yes, Raul, stick a pin there, stick a pin. We'll be getting to that. But before we do, quickly, the new National Party announced new caretakers. There's been, and of course, Dr. Bishman, I have a quick question. Did you vote in the last election, sir, in Grenada?
No, sir, I've never voted in Grenada.
You never voted in Grenada, okay.
I left Grenada. Right. Never voted in Grenada, sir.
Okay, all right. But let us get to the new caretakers, the new caretakers for St. Patrick West, St. Andrew North, Southwest, that is, St. George South, and Raul, help me out here. There is another.
St. George, St.
David. That's right. That's St. David. I wonder if that has clipped the Prime Minister's travel wings with the announced new caretaker. I don't know. I'm not too sure there. But let us talk about the new caretakers. Raul, you are in the fire line recently for saying that the NNP announced the new caretakers, but that Doc still wants to hold on, that he does not want to have a caretaker in his constituency. First, let's talk about those new caretakers and Dr. Mitchell's role in the next round of electioneering in Grenada. Raul.
He has a role to play. Yes. He has a role to play. I'm not sure if he knows the role that he has to play, but he has a role to play. Emlyn Pear has to understand her role, and in my view, if she doesn't, she is the political leader of the NNP, and she has to define things. She has to be seen as the one who's doing things. She cannot be seen as being influenced. The perception cannot be generated that Dr. Mitchell is calling the show and calling the shot and influencing the process. He has a powerful role to play. That's no dispute. But Emlyn has to step up as the leader and be seen as the leader, because when time to make decisions, politics is about winning the election. You do what you have to do. You collaborate with who you need to collaborate with to win the election. You don't want her to be in a situation where she has to make a decision for a level of collaboration to take on an NDC, which has momentum, some momentum now, and she can't do it because Dr. Mitchell says no, right? So she has to stamp her mark, her presence on the NNP and move forward. I like a lot the fact that a lot of young people are coming on. Jelani, Amanda Japal, I see her as a nice rising star. She has to be guided as well. Nolene is giving some hell in St. David's to the Prime Minister. So I think she's making him sweat a bit.
Well, that's a good thing, right? I mean, competition.
So that's politics. That's a good thing.
Democratic process, yes.
Yes, that's a good thing. So that all of that is happening. I like the fact, but the young ones emerging, they need leadership and seasoned senior ones to guide them, because a lot of mistakes can be made. And we saw an NDC winning election in 2022 with a lot of young ones, and they made some mistakes. Let's be honest, they made some mistakes through not understanding certain things. So they made quite a few unforced errors, as they say in law and tennis. In fact, my good friend Linda Strick, I think she used the word rookie, or there's another word which she got in trouble for. But yes, so basically,
I wonder if our dear friend Linda would be saying the same thing about the new caretaker candidates, because the argument can be made that here you have the NNP who critique the NDC for having what Dr. Mitchell calls them little children in parliament sometimes, having his own little children on the other side. No, I mean, you know,
we gotta start somewhere.
No comparison.
No comparison. But we will get to you, Miss Simon. We'll get to you, Miss Simon, on that.
Yes.
Miss Simon, let us talk about those new announced caretakers. Are they giving a shake of the ground? What's that looking like for the government? Is that giving them a reality check as to what they need to be doing?
It has been. But I'll take what you said last there first. To compare, to say that they're rookies. They might be rookies, but there are those within the party, like their leader, that's been there, done that. You have MP Kate, you have Nolan Cox, you have these people been there, and so can guide, as well as the ones in the background that can hold the steering wheel while they mash the gas. While they're pressing on the gas, need somebody to hold on to that steering wheel. Different to to this administration where they were all rookies. No matter the age now, we're not talking, but they were all rookies. And as the word is out there, nobody's taking advice. So this is why we are where we are today, right? And as I say that, I want to just jump back to what Roll said about the system, the NADMA system collapsing. And that is indicative to what is happening with this administration, because they are placing round pegs in square holes, keeping the nepotism going. And they're so hiring their people and putting them, whether they can do the job or not, and destroying our institutions by doing so. So to come back to the politicians now, the new caretakers,
the new kids on the block.
Yes, the new kids, and they, in my mind, they're doing a very good job. They're doing what they have to do at this point. They're on the ground, meeting the people, speaking to the people, listening to the people, and acting. And in my mind, that is what needs to be done. So you cannot compare them with the rookies and yes, they made mistakes, Ron. They made a lot of mistakes and still are making mistakes because they're arrogant. They're all arrogant with it. And so they're not learning. It's like we are here. This is our time now. In fact, they say, and let's just have a good time. And that's what they're doing, forgetting the people that they said they were going to put first, forgetting the people. And that's where they do that. But as I must say, I admire Ms. Thompson, Nolan Thompson, and the way she's going about her campaign on the ground.
Excellent. And that's a caretaker for St. David, the Prime Minister's
excellent. And it is no joke that the Prime Minister is out there in the sun, in the dark of the night. He is there. And something the people of St. David's, in the little corners, in the different little villages are saying, even after he won the election and 3 years into it, they have not seen him in some of these small villages, and now they are seeing him. It says a lot.
Well, I suppose that's a good thing that having that counterweight, forces politicians to sometimes get back to their true North Star, which is serving the people.
I must just add one thing that I must say, because it's a perception, as Raul said. Initially, he was heading like, okay, it is what it is, but then he came back and said it's a perception that Dr. Mitchell is running things, because nobody could say that Dr. Mitchell is running things if you don't know it for a fact. So it has to be perceived. And you see, it was perceived that when Dr. Mitchell said he was stepping down, it was perceived that that was a gimmick and that he is just leading Emmeline Pear on. He did step down and she became the leader. When she became the leader, it was perceived that he will not let go of the leader of the opposition and that he's going to keep it. And by the next convention, he's going to come back the leader. He stepped down as leader of the opposition. Another perception. Now it's perceived that he is the one running the party and not me. What does that say for a strong young woman who has stepped into the ring, and in my mind, and from what I see, is doing her best. Well, not to the point of the top of her game, but at this level, at where she's at, just stepping in, she is doing her best. And if we keep this thing with Dr. Mitchell, it's like you guys can let go of Dr. Mitchell. And then you condemn when he come out and he gallery. Let it go. Let him go. Leave him. Let's talk about what Mrs. Bear is doing and not Dr. Mitchell. We speak about in your article, Ron, Dr. Mitchell going to the States to do his medicals. That's a great percentage of Grenadians who can afford it. They do. Your boy Peter David, he goes to the States to do to get his medical, his injection and thing. He goes to the States. You didn't say that in your thing. You jump on Dr. Mitchell, going to do his medical. Recently, Peter went to the States.
Can I come in?
Recently. So it's not a Dr. Mitchell thing, though. Is his right, especially at his age. I wish I could have gone to the States to do medical. I would go to do my medical in the States as well.
Or maybe buy some nice outfits in Miami, but I digress. Dr. Bridgman, quickly.
So in my mind, just leave Dr. Mitchell alone. And let's focus on who's in front of us.
Right, front and center. Yes. Dr. Bridgman.
Eminent pair. And if you say, and just let me finish up this here. And Dr. Bridgman mentioned that he don't know of any leader in the Caribbean who does that. Have you seen Keith Rowley and heard Keith Rowley? Are you kidding me?
Okay.
Come on now.
Yes, Dr. Bridgman.
A few things, and boy, it was a lot. So I try to remember. I don't necessarily take notes.
Right, don't like me.
Jen, let me just say this. You said people, the perception, and people talk and leave Dr. Mitchell alone. Why people are talking about it, because you don't have in organizational leadership and in systems that where the political leader resign and become chairman of the organization. That's a big piece. So this is why people are saying that he's still calling the shots, okay? Because he's the chairman, and the chairman of the party is really to build infrastructure, the internal working of the party and stuff like that, the fundraising pieces. So he's playing a very big role. So that's one of the reasons people are saying that he's still in charge. And also his years, and knowing who he is, his personality. So those are the evidence people are using to say that he's still in charge, who he is. And you can't fault them for that because of who he is. Okay, with regards to the new folks that have come in, and yes, during the 2022 election, I did criticize NDC folks with regards to youthfulness. As a matter of fact, and I still call it youthful exuberance. They do a lot of stuff that are of youthful exuberance. And you're right, Jenny, that within the NNP now, that it's not only young people. There is a blend and a mixture of the old and the young, which is good. This is what it's supposed to be done. Okay, so I'm glad that I'm seeing new people coming in and taking an active role on the ground, engaging people. The engagement is one piece. As I said at the beginning, your policies, what you stand for. I have not heard, and Jenny and I have spoken about that, I have not heard NNP coming out with any policy, no initiative. This is why I wrote this morning about we can't just wait until election is called and you're coming out with a manifesto. You're coming out with your policy statements. Because again, it's politics as usual. There we go again. We need to have something really of substance, of seriousness, that this is my policy. This, even though, people talk about, if I come out with it, the government may take it. Who cares? An idea is an idea, is a good idea. Let's deal with it. So you can engage people, you can listen to people, which is very important in politics. As Tip O'Neill says, and Dr. Bubb, you know that all politics is local. So you got to be out there on the ground, and that's something I think NDC is not doing well. Okay, you have a few areas, and you can look at the data. Dunpierre and Barrett and Company, or Grenadian, Dr. Pierre was on Dr. Bubb's program a couple of weeks ago, and the data is there to support that. When was the last each of these two parties did a survey of their people? Are you going back to do the same thing again that you did before, believing that, okay, we have been there, we have been doing it for a long time, therefore people know us? This is different. The political climate in Grenada is different right now than it was in 2022. So I want to hear ideas, Jen. I'm really craving for the ideas. And that's when I will think, Jen, that it's different now under Mr. Spear.
Well, I can't help it.
Ms. Salmon, yes, a quick right of reply. Yes.
I can't help with NMP ideas and their policies. I'm not on the inside of the NMP to tell you that.
We always
what I can tell you is what I hear the political leaders say. And she has come out, they have come out and speak a little bit policies. And she says all the time that they're going to continue, Emily, the political leader of the NMP.
Which policy? I hear a lot of criticism about the government.
And what I heard her saying is that they're going to do what the NNP did, but better. The NNP is a party. They're not dumping everything in the drain. They're continuing because NNP, as Ron said earlier, not good policy. You said so. That's why you are part of NNP. I assuming it was some of their policies, and so you agree. But you gone with Peter now because Peter didn't get what he wants, so y'all gone down the road, and now nothing in NNP is good anymore, right? So you all gone down and you have your own policies, which I am waiting for with bated breath, my dear, to see what the movement policies are.
Yes. Yes. Raul, let's get over to you, and we have to get to two issues before we close the show. Raul, anything else? I think Jenny said that Peter is your good friend. Is Jenny, were you referring to Raul as well? Are you
good friend? I'm just saying that he wrote about Dr. Mitchell going to do his medicals and whatever, and making it sound as though that's something new, and so on. He left out the leader of the movement, who was in the US twice recently for medicals as well.
So let me speak.
Raul, quickly.
No, that's okay, because I do, in terms of, I mentioned a few names earlier that I admire, and Peter is one of them. I didn't mention it earlier, but I mentioned it now. I like his ideas, and I like his politics. He talk a lot.
And you also gave Dr. Mitchell credit as well, to be fair.
Yes, I give but let me just say something. The reason why Dr. Mitchell is an iconic political figure in Grenada for 44 decades, 40 years or more, whatever. And so his policies has impacted multidimensional aspect of our lives. So he stands out as an icon. So it's not strange that every move he makes, it's like a subject of comment and that's good. People wanted to doc, well, good or bad. So he will always be an issue that people would like to comment on. But reverting to the ideas, Dr. Bridgman, yes, I love ideas, Jenny, and I would like to see the ideas come out, but I like to see ideas transformed into policy and then implemented into practical things on the ground. And then one administration comes on, that's a good policy, you implement it, you don't kill it. The Imani program was a very good program. It's not perfect, but it was a very good program, and I could testify that there are a lot of young people who didn't have a chance, got that chance, and they are now in a lot of top positions. That's just how it is. The debushing program, a lot of people diss the debushing program, but the debushing program is almost like a sub-economy that generates economic turnaround and so on. So we have to look at all that's good. And if something is good, how can we just not move with it or try and perfect it as opposed to abandoning? This is the maturity level that regardless of shades of politics, orange, green, yellow, I wish we could reach that point where we can agree, this is good, let's run with it. That is good, let's run with it. This is the point at which we can get to.
I agree with that.
So we have an agreement here among the panelists here. Good ideas. Let's stick to
one thing before we move on, Dr. Bubb.
Quickly,
because
yes.
I have to say that Dr. Bridgman spoke about he don't know of any other party maybe in the Caribbean who the leader or prime minister went to be chairman. I don't know of any either, but I do know of a couple where the prime minister and leader stepped down and took part in the next election and ran as candidates. Mm-hmm. And that is our friend Kenny Anthony in St. Lucia and the gentleman in St. Kitts.
Okay, very well. Okay. Yes. Now the final issue, lady and gentlemen, that we will be addressing today, because we really ran out the clock. But today's program I thought was very eye-opening in respect of the Project Polaris I don't know about you, but I feel I left with the feeling that more questions need to be answered, and I'm glad that they made themselves available. But and that is, of course, the tragedy that occurred in St. Mark, involving Wello, who will be laid to rest next month in his home parish. Of course, that tragedy rocked Grenada in so many ways, and it harkened back to the Oscar Bartholomew police-involved killing in St. David as well. Of course, the officers involved, one of the people involved allegedly in this was charged, and the matter is in court. So we're going to be very guarded in respect of how we address this. But Raul, I want to begin with you here in respect of police accountability and just your observations in respect of how this matter was handled by police.
Right. So
and the national security infrastructure, meaning the prime minister and so on.
Yes. So just to back up, for a few years ago, I remember covering stories in Grenada. I think it was the 90s come up. And I have on a hard drive somewhere a lot of stories I would have done in where, quote unquote, mad people in the community act up. Crazy, I don't want to use that word. Let me use a better word. Mentally ill people act up in the community. And the community person called the police. And the police come, boom, they shoot them, they die. So, and to my recollection, there might have been about 13 or 14 of these over a 10-year period where police just come in the village, shoot, no de-escalation technique, no technique to address the matter, right? And so the families have to mourn, there's no compensation for the families, that sort of thing. We don't have that system here. And that has happened over the years. Fast forward to this issue with Wello. It's so unfortunate where this has happened to him. Will his family be compensated? With the police and reference to your matter with Oscar Bartholomew that you talked about, that was so unfortunate. His mother died, mourning the loss of her son, and so on. Has she been compensated? Has the wife been compensated? What's the issue around that? And the whole issue that Jerry, the lawyer, is championing, the issue of an independent commission to monitor police conduct. We have come from an era of mongoose gang and police brutality and Duffers Commission, and all these things come up over the years. And we still cannot say and agree and move forward with a situation where we have an independent body. It's good for the police too, and it's good for public, where you can monitor police conduct. I'm not trashing the police, right? But I'm saying policy and procedure and accountability and transparency. You have to protect citizens. So I'm saying all of this to say there has to be a greater emphasis on protecting the citizens. It's not just about to eat a food and give a man a work to walk through politics and so on. You have to be seen as protecting the people, whether it's the money that we lose through insurance, how much thousands of dollars we lose through insurance, or whether it's from police brutality or from what things, social protection, security protection. There has to be an emphasis on protecting people. And in many instances, when that doesn't happen, you have to be compensated. You saw an accident with it last week in St. David's. Somebody could have died. We have had an increase in road accidents and in situations where innocent people have died as a result of that. The mentally ill person a few months ago on the Kelly's Road, how his family is compensated. Can we sue? Can you sue for compensation? All these policies and things this is how you help people as well. It's not just about my party in power. Give me a work, and that's it. And we as the public have to take some of the blame for that too, because we don't advocate. Because what we do, my party in power today, Grenada is a paradise. Tomorrow, my party in opposition, Grenada is the worst place. So there's no uniformity of advocacy. Political advocacy, not party politics advocacy. Advocacy at the political level where you advocate for consumer protection, security protection, social protection, welfare protection, healthcare, and all those sort of things. Those days of freedom fighters don't seem to exist anymore. And the politics has played a major role in diminishing this. And one last point, I just want to quickly mention where the media is concerned, because the same politician will jump up and say, oh, the media ain't doing this, and the media, and they complain about the media. But it's the same political structure, whether it's NNP or NDC, that dilute the media in Grenada. So you have few people standing up and challenging them, and everybody afraid not to comment, because you have a lot of the radio stations who were handed out the owners were handed license on a quid pro quo basis to operate a radio station, so they're loyal to the politician, and that has served to diminish the ability to challenge the political governance. And the one or two who challenge them has to be villainized and has to be ostracized, right? So that's the point I want to make.
I was muted there for a second, but I'm glad you raised a point about media here. But that's a whole entire conversation that we need to have. But Ms. Simon, on the question of the Wello tragedy in St. Mark, I think that has really galvanized the national community in Grenada to support Wello and his family at this very difficult time. It must be a very difficult time for the family and for the community of St. Mark.
Yeah, and I believe more than compensation, it should be prevention. Let's see how we can try to prevent these things from happening. And if you notice now, there is a total breakdown between the police and citizens. I mean, in any event, whether it's a school child in town and the police trying to put law and order, it's a confrontation and a square up. Even after Wello was shot and lying on the ground with bleeding, there were young men confronting the police, squaring them up. And the police stood there in some cases like, okay, keep their hands by their side. Now, to date, we don't know the real story of what went on, because you're hearing several different stories. Even as far as one of the victims that got shot, where that individual was, the distance is too far away to claim that the policeman is Noel shot him. So you have a lot of things, and that's why we can't really get into this one right now. But my thing is, they have to be something to help. They have to do something to help with the relationship, to mend the relationship between the police and citizens, because we would have a lot more of that. Now, when it comes to the mentally ill, I'm not saying that the police should show up and just shoot. It depends on if, as we would say, their hands are tied. Because as a child, just starting the St. Joseph Convent, I remember as if it was yesterday, a mentally ill man going into what we call the NCB Bank, right there by where Barrett was, and chopping people to death in that bank doing business on an early morning. I don't remember what day it was. I remember it as clear as day, right? So it depends on situations, right? And we can't always blame the police for that. Although there are ways they could restrain. I don't know if they have rubber bullets here and things. If you know you're going to deal with a mentally ill person, maybe that's the way out. But with prevention, we have to find ways to mend that relationship. The police have to work on it and to mend that relationship, especially with the young men. Because anytime there are words between a police and a civilian, even women, I see the police beating a woman, dragging her, all her underwear outside in town, in St. George's, right? What can this woman do so bad? This young girl, it wasn't even a woman, probably in her 30s. Well, a young woman. What can she do that bad to a police officer who has weapon and baton and all of that you's dragging it through the streets with her underwear outside and she's bawling and you keep dragging, right? So there has to be some sort of mending of that relationship, because it's going to only get worse. We have Carnival coming, and the alcohol and the weed smoking and all of that is going to influence more of that. Something has to be done. It's out of hand now, really out of hand.
Dr. Bridgman, on the question of the Wello tragedy here, how have you reacted to this?
I do agree with Raul and Jenny, so I don't have much to add with this, because they really made some great points. Two things I would say: that community policing is really important. I mean, we've seen it back here, Kellen, back in the David Dinkins administration in New York City, community policing, where cops be part of the community, that people knew the cops. So those things are really important, that they walk the beat, they talk to people, they engage with the young people and all that. Because as Jenny said correctly, that when things happen, like, the shooting and stuff, the young people now want to go after the cops. So we need to de-escalate, ways to de-escalate conflict. The cops need, and again, they're law enforcement. And they're trained in terms at times to react because they want to really create peace in terms of making sure order is being maintained. But they need to learn techniques, de-escalation techniques. It's important. I think that they do that. The situation is sad. A parent, someone, brother, sister lost someone. I think, as Raul said, I mean, for me, if I have an event on Long Island, and in the number of people, and I have to get permission, I have to say how many people will be attending, and the EMS vehicles have to be there. It's important that in case a situation arises, it's just, if there's a game, there's a football game, I have to have EMS available. So we need all those things in Grenada with regards to events. And people have to learn also to respect our police officers. With regards to mental health, Jenny, I think we have to do a better job with mental health in Grenada with regards to mental illness. People are walking around with a lot of issues and they don't have anyone to talk to, and we don't have the specialization, we don't have the professionals out there to do that job. It's needed. So police officers going out to arrest someone at home, they don't know what they're getting themselves into. So we really need people to help them with regards to those situations.
Mm-hmm. Yep. And Dr. Bridgman, at this time, I want to offer you an opportunity for closing comments. This has been a very robust segment, a lot of robust conversations. Of course, as a programming note, I wanted to be known that we did also invite Larry Barry to the Bubb Report, to this particular segment. We did not hear back from him. We extended a previous invitation. He said he was not available for that day. We had to reschedule the program. We did reach out. We did not hear back. But of course, it was our intention to have Mr. Barry here of the NDC on the program as well. But Dr. Bridgman, over to you, sir, for some closing comments.
And Dr. Bubb, again, thank you for the opportunity. And it was good to really to dialogue with Jenny and Raul. And this is a good example for our people that you can disagree and not be disregardable and not be personal. Dr. Bubb, too often, and I know under your live right now, maybe people are going back and forth and saying a lot of hurtful personal things. We need to elevate our politics. We need to elevate our discussion, that I can, discuss, go back and forth with you in strong debates. I love a good debate. But at the end of the day, there is no personalization. There is no harm. So we need to really cultivate that in our politics. And I'm calling upon our leaders to do that. We need to educate our people. You can be a strong supporter of NDC and still listen to a different view of it. You don't have to be angry with the NNP person who said it. The same way with NNP folks, you don't have to. I read stuff, I listen to stuff, and it's a sad reality of our people. We need to do better. But I really want to thank you. There is a need for us to come together with our politics. Grenada, I think currently there are about 86,000 people registered to vote. In the last election, you had 31,000 voting in NDC, 28 voting NNP, so you had a gap of 20,000 people not voting. And Jenny, this is where the movement comes in, the disenfranchised. Okay, someone sent me while we were speaking here. I like to mess with Jenny. Someone sent me something stating that which political party that brings out the policies 3 years before an election. That's the problem. We need to change this paradigm, because you need feedback. You need people to come to you and tell you that, hey, this is not working. I don't, you have some good points here and those kind of stuff. You don't wait until the election is called to say, let me come up with my manifesto and my policy. People look at it and say, there you go again. You're not real. You're just giving us something because you're not going to read it. But this is really good. Dr. Bubb, I want to thank you for your 5 years of doing good work and bringing people together to discuss the issues of affecting not just Grenada, but globally. Thank you.
Absolutely. Ms. Simon?
First, I want to say thank you as usual. But I heard you said that you'd invite the NDC to come on the program. You didn't invite the NNP.
Well, I invited Mr. Well, yes, but I invited Mr. Barry. Mr. Barry's no longer
Jenny's representing me.
Okay. I put my foot in that one there. Yes.
Oh yeah. It's for me. It's looking at the administration that's in office and giving my opinion. I'm a commentator, flat out. I did it for 5 years as an NDC when NNP was in office. I did it. I talked about the corruption. I talked about the CBI. I talked about, and this is what I'm going to do today. Who like it, who don't lump it. Because I am going to do it. Because right now, you have no idea the amount of people who come to me, who get my inbox, people I don't know who they are, who get my number and message and discuss and talk about the issues they're facing, who are afraid to speak out, who are afraid, literally afraid. There are persons who are literally afraid to even look at Simon Says when it's live. So they said to me, "Let's go back." And they're whispering, nobody's around, but they're still whispering. Let's go back and look at it after. They are afraid. And I did that type of program before, and I said it. I hosted a Heartbeat, and I have never had it like this. I have never had it like this. And I'm saying this to say that this is the worst I've seen of victimization, nepotism, you name it. Things that this administration said on their coming that they would change because it was there and that they would change it. But instead, it got worse. And I would just want to continue. God give me the strength, the knowledge, wisdom, and the understanding to continue to speak out for the voiceless. It's my passion. I do it, and I'm just hoping that I can continue to do so. Thank you for giving me the opportunity. I love you both. Guys, I love you both.
Okay.
And Raul, over to you, sir. You get the final word.
Okay, just to segue from one quick point that Jenny made, ending up in terms of the interference. The union leader, the new Public Workers Union leader, Sister Daisy, also made that point. Remember, she was on record making that point. She said the level of political interference is unprecedented, and she went back comparative to way back as Revolution era. So she is also concerned about that. And don't forget, if the CAPSEC evidence exists where the CAPSEC cabinet secretary sent that letter interfering into the operations of the union. I mean, if the union, after 30 years, raise an increase in fees and they do their business and they agree on that, how can you challenge that and do a letter surpassing the union directly to the workers asking for proof and evidence and on all that sort of thing? So that's an issue. That's an issue to look at and to discuss. There's some other issues we need to be monitoring, and no time for this now, but the issue of the relationship between the union and the government, there seem to be a lot of issues there. The pension issue seems still unresolved. The law has been passed.
And there was also the issue involving the vote for workers, I believe, at the airports. That also, and of course, the government did respond by way of the Ministry of Labor to this as well. Yes, go ahead.
And then, of course, the government's housing policy. I mean, you invite people, you give them their papers after the first documentation, which says they pay $1,500 and $500. Will they finish paying? No, you're telling me they have to pay for the land. The issue of Karakou, the housing post burial, and the issue of people having to pay for housing now when based on the Chinese deal. You have to look at the government policy. Is it anti-poor people? Is it pro-poor people? And you have to keep questioning it. So, and there's nothing wrong with that. It's just that now a lot of people, social media platform magnify this. So if you criticize, people come and they attack you. And that has been happening long on the NNP, on the NDC. You criticize, you critically analyze, you don't like us and we fight you down and all that kind of nonsense. I want us to go beyond that point. So thank you very much. A good discussion. Dr. Bridgman, I know you committed to Grenada and you've done good work. Jenny, continue your advocacy. I monitor your program. I like a lot of what you're doing. It's in the interest of public information and holding the government to account. It's not about whether we like them or not. We want the government to succeed, because if the government succeeds, Grenada succeeded. And Dr. Bubb, you came from the ground up, grew up as a journalist, doing very good work. Continue on your mission. Thank you very much. Have a good Sunday, everyone.
Yes, absolutely. Ladies and gentlemen, thank you. And again, as I said in the lead up to this segment, what we try to do from time to time is to just do a debrief of the issues animating discourse and the issues animating development in Grenada. And so that is what this segment was about. We did a similar thing last year as well. And at the end of every quarter, we try to do that whenever space allows and whenever our programming allows. And that is what today's program was about. It was a freewheeling conversation on the issues that affect Grenada and its development. It was not necessarily a specific themed, focused panel per se, but to address all of those issues and bring a multiple voices as possible. Again, I have no agenda here, even though people seem to think otherwise. But if I were to say what my agenda is, I think Grenadians will give me fire for saying that I want to bring a certain agenda into Grenada. So I will not go there. But ladies and gentlemen, I want to thank you all again for appearing on the Bubb Report this week. And of course, viewers and listeners, what we will be doing next week, we will be getting back to some other serious issues impacting development in Grenada. Of course, we will not let the cat out of the bag, but there will be another blockbuster program next week. So please stay tuned for that. And of course, on behalf of my producer, Mr. Rian Charles, I want to thank all of you for tuning in to this week's edition of the Bubb Report. And we will see you next week again for another installment of the program. So again, I want to thank all of you for tuning in and have a wonderful Sunday. Again, those of you in Maryland, those of you in the DMV area where I'm located, I hope that I will see as many of you as possible out there at the Caribbean Wine and Music Festival, the Caribbean Wine and Music Festival that is being held. Let me just pull that up here for those who may not know about it, but who have an interest in going. Of course, it is a holiday weekend here in the DMV area, and that Caribbean Wine and Music Festival is being held today from 10 to 6 in Mount Airy, Maryland, at the Linganore Wine Cellars. That's in Mount Airy, Maryland, where I hope to see as many of you as possible there from the Grenadian and Caribbean community here in the DMV area. So once again, I just want to say thank you, all of you, for tuning into this week's program. Please give us a like, please give us a subscribe, and please continue to follow the Bubb Report. So thank you again, and we will see you next week for another installment of the program. Take care. Bye-bye.
We seek the truth.
Would you be handing your resignation to the Minister of Culture tomorrow, sir?
No, I will not.
The leader of the opposition, you have accused your government, sir, of using the Grenada Development Bank to facilitate the financing of personal loans for certain government ministers.
The other side is in no position to talk about those issues, and I will leave it there.
We discover new perspectives.
You know his leadership style. And so many are saying, why are you coming now to talk about those issues?
Now is the time to speak. You have the right to decide who will take over.
And you met with Dr. Mitchell, and perhaps you might want to confirm what that meeting was about in your response. But
Dr. Mitchell, like myself, are Grenadians.
We ask the right questions.
Why was there no report on the work done of the commission? And how is this new committee different from the commission that was initially established back in 2022? So who are these elements that are using you?
I'm disappointed in my political leader.
And why is that animating those political conversations now?
This is a very interesting question.
The Bubb Reports with Dr. Kellan Bubb. Thought-provoking, truthful, unbiased, and truly original reporting.
Hi everyone. Thanks for checking out the Bubb Report's social media pages. If you'd like to get more videos, show highlights, and watch our weekly live show, follow our Facebook, Twitter, and Instagram pages, and also subscribe to our YouTube channel. You can catch repeat episodes on Wednesdays at 4 and 5 p.m. respectively on CRFM Radio and GBN TV in Grenada. We are also viewed on Sundays at 8 p.m. on WPG 10 throughout the Caribbean. Thanks for watching.